자, 시작합시다.
안녕하십니까. 대한민국 경주에서 개최되는 2021 국제노타리 회장 경주 컨퍼런스에 참가하신 모든 분들을 환영합니다. 저는 이번 행사의 사회를 맡은 국제노타리 3650지구 사무
Good morning. My name is Yoon Sung Hwang. I am the Secretary General of District 3650, and I am the Deputy Secretary General of the same District 3650. It is a great honor and pleasure to be able to moderate the RA Presidential Conference. There will be a total of 6 presidential conferences hosted by our President Sheikha Mehta of Rotary International during 2021 and 22. The first of those events is being held here in Gyeongju, Korea. The theme of this presidential conference is disease prevention and treatment, and also the new area of focus, which is supporting the environment. We have invited distinguished speakers from both Korea and Japan to give in-depth presentations. We look forward to your continued participation and support so that this presidential conference can be a success, although it is being held in the middle of a pandemic. A few housekeeping announcements are in order. This event is being hosted while complying faithfully with quarantine guidelines. It is a hybrid conference. Leaders of Rotary Korea, as well as President and Mrs. Sheikha Mehta of Rotary International, have come to the K Hotel here in Gyeongju in person, and also many global Rotarians are with us via YouTube. If you do a YouTube channel search, 2021 Rotary International Presidential Conference, you can participate. Once again, the keyword on YouTube is 2021 Rotary International Presidential Conference. I'd like to ask our Rotarians joining us via YouTube to let people around you know so that more people can participate in this YouTube live streaming. Through additional editing, each session will be made available on the 2021 RI Presidential Conference YouTube channel after today, so that you and many others can look up this conference after today's event is over. Also, simultaneous interpretation is being provided in Korean, English, and Japanese. Those of you who need simultaneous interpretation, please use the receivers. As for the channels, Korean is on channel 1, English is on channel 2, Japanese is on channel 3. Please set the channels on your receivers now.
Please set the channel of your language choice, number 1 for Korean, number 2 for English, and number 3 for Japanese. Once again, it's number 1 for Korean, number 2 for English, number 3 for Japanese.
아울러
Also, those of you joining us via YouTube can view today's conference.
Once again, Korean, English, and Japanese on YouTube channel.
그럼 먼저
First, a introductory video to Rotary, as well as a video introduction to the host city of Gyeongju, which is an ancient capital of millennia.
낄 수 있을까요? 굶주린 자에게 식량과 목마른 자에게 물을 주면 어떨까요? 아이들에게 읽기를 가르치고 건강을 돌보면 어떨까요? 쉼터를 제공하고 신세대를 교육시킨다면 가난한 이들에게 더 많은 기회를 주고 평화 중재인들의 네트워크를 만들고 수백만 명의 목숨과 자유를 앗아간 질병을 퇴치한다면 한 사람이 할 수 있겠습니까? 120만 명이면 어떨까요?
My name is Frank Wessel.
Tamara DeWitt.
Gaston Cabate.
Eu sou Adélia Vilas.
Dr. Naresh Goyal.
Meu nome é Awalma.
Gary Parrish.
Warren Coffin.
Lisa Simmons.
Eric Kimani.
Meu nome é Eduardo.
Singh Arora.
Megan Coutinho.
이러한 남녀들이 세상을 변화시키고 있습니다. 그들은 노타리 회원입니다. 전 세계 3만 2천여 클럽에 소속된 지역사회 리더들로서 지역, 국내, 그리고 국제적으로 자원봉사 활동을 펼칩니다. 그리고 초아의 봉사 정신으로 헌신합니다.
That's what.
바로 그것이 로타리입니다. 생각하는 비전, 믿고 있는 확신, 그리고 행동하는 용기입니다.
많은 사람들이 뒷전에 앉아 불우한 이웃들을 돕고 싶지만 어떻게 해야 할지 모르겠다라고 말합니다. 로타리는 이웃을 도울 수 있는 길을 제공해 줍니다.
로타리안이라는 사실만으로도 전 세계로 향한 문을 열어줍니다.
로타리 회원들에게 너무 큰 프로젝트란 없습니다. 로타리는 유니세프, 세계보건기구, CDC 등과 함께 20억 명 이상의 아동들을 소아마비로부터 면역시켰습니다. 그리고 전 세계 소아마비 발병을 99%까지 줄였습니다.
Not too many dollars.
로타리안들과 파트너들은 적은 비용으로 이 엄청난 일을 매우 효과적으로 그리고 효율적으로 진행시키고 있습니다.
로타리는 국제 교류 및 장학금 프로그램을 위해 5억 달러 이상을 사용하였습니다. 분쟁 해결 분야의 대학원 과정은 전 세계 평화 중재자들을 연수시키고 있습니다.
When I started working,
UN 인터폴에서 일하기 전부터 국제 관계에 대한 지식을 갖고 있었습니다. 로타리 회원들에 대한 보상은 헤아릴 수 없으며 즉각적입니다.
Helping others is
다른 이를 돕는 것을 정말 좋아합니다. 저를 행복하게 해주죠.
정신적인 보수가 너무나 많아 그 가치를 설명할 수 없습니다.
로타리안이 된다는 것은 자신을 위한 것입니다. 남을 돕지만 더 많은 것을 얻을 수 있습니다. 감동과 희망이 없는 세상이지만 인종과 종교, 피부색이 다른 로타리 회원들은 서로에게 관심을 쏟고
현실적인 희망과 도움만이 아니라 정서적인 면에서도 도울 수 있었으면 합니다.
보호하고
해야 할 일은 반드시 끝낼 수 있습니다.
관계를 맺고 이 프로젝트가 끝나면 아이들이 의사 선생님들과 사진을 찍으러 와서 눈물을 흘립니다. 변화를 위해 모였습니다. 로타리안이기 때문에 가능합니다. 우리는 할 수 있으며 또 해야만 합니다. 120만 명의 자원봉사자들에게도 세상을 변화시키는 일은 쉬운 일이 아닙니다. 귀하도 어떻게 참여하실 수 있는지 알아보십시오.
강물은 한 방울의 물로 시작됩니다. 우리가 바른 방향으로 가고 있는지 일이 완수되어 가는지를 확인하는 것만이 우리가 해야 할 일입니다.
국제 로타리, 비범한 것을 이루기 위해 함께 모인 평범한 사람들입니다.
네, 지금 저희가
You have seen a video introducing the beautiful city of Gyeongju where we're at, and this was also a video to highlight the Rotarians' commitment to service. Now let's take a look at a video of our President Shaker Mehta, who has visited Korea. A brief introduction of President Mehta is in order, I believe. Yes, he hails from Calcutta, India, which is known for Mother Teresa and the great poet Tagore. President Mehta of Rotary International from 2021 and 22 is a successful accountant and businessman. He is a director of the Indian arm of Operation Eyesight Universal, which provides more than 50,000 eye surgeries each year, as well as being the founder of Saving Little Hearts, which provides heart surgery to over 2,500 children with congenital heart disease. He also helped to build 500 homes in the Andaman and Nicobar Islands after the 2004 tsunami that hit Indian Ocean. He is also planning and implementing the TEACH program in 10,000 schools to eradicate illiteracy in India by 2025. Mrs. Rashi Mehta calls her husband a positive and passionate man. He is also a loving father and grandfather to his grandson, whom he calls the sunshine of his life. Let's meet President Mehta and his introductory remarks via video.
Hello, the movers and shakers of Rotary. You, presidents-elect of Rotary, are the movers, and I am shaker. Your term as president will be the most amazing, fruitful months in your life. During your term in leadership, dream big using your vision, plan, and set goals, and then inspire and motivate Rotarians to reach goals. Goals to expand our organization by increasing membership and increase the impact of Rotary by serving the world. Friends, one of my mantras in Rotary has always been, do more, grow more. And I hope you too will take this as your mantra. Do more as in bigger and impactful service projects, and grow more as in increasing our membership. I've always been greatly inspired by the motto of Rotary, service above self. It has taught me to care for others, share with others. Service to me is about thinking of others even before I think of myself. Rotary kindled the spark within me to look beyond myself and embrace humanity. Service became a way of life for me. And my life's guiding philosophy became service is the rent I pay for the space I occupy on this earth. And I want to be a good tenant of this earth. In the coming Rotary year, I request you, urge you, cajole you to serve people and to help change their lives. So friends, our theme for the year, as you know, for the year 2021 is Serve to Change Lives.
That was a video of our President Shaker Mehta. On a personal note, this gave me a great impression when he said that it is natural we should pay a lease while we're living as tenants on this earth. That was the point that was most driven home to me during the video. How about you? The part where President Mehta says, do more and grow more. That left an impression on me. I know that many Rotarians will work harder and volunteer more to put his words into action. Once again, ladies and gentlemen, if you enter the search word 2021 Rotary International Presidential Conference on YouTube, you can participate in this conference. Those of the Rotarians who are participating via YouTube, please let people around you know that this presidential conference is being live streamed. After today's event, through additional editing, each session of this conference will be uploaded to the 2021 RI Presidential Conference YouTube channel, so that you can enjoy the conference through video after today. Starting from 9 a.m., the presidential conference will begin, so I'd like to ask our participants to be seated so that we can begin. President Shekhar Mehta is entering the room. Please welcome him with a big round of applause.
네.
Again, through additional editing, the conference today will be uploaded to our YouTube channel called the 2021 RI Presidential Conference, so that you can look up the video even after today's event. Also, simultaneous interpretation is being provided. Those of you who need simultaneous interpretation, please make use of the receivers. Turn to Channel 1 for Korean, Channel 2 for English, and Channel 3 for Japanese. Please set the channels on your receivers now.
Receiver on your table, please set the channel for your language of choice. Number 1 for Korean, number 2 for English, and number 3 for Japanese.
네, 아울러 유튜브 영상
Also, those of you joining us via YouTube can also choose the language of your choice.
Right now on the YouTube channel, number 1 for Korean, number 2 for English, and then number 3 for Japanese.
That was a great performance with the participation of Rotarians. This congratulatory performance was edited by the Chair of Cultural Events of District 3650, Jeongnim Seo. Now let us begin the main part of the presidential conference. For the benefit of others, I'd like to ask our participants to kindly turn off your mobile phones. We will now invite Vice Chair of Rotary International Foundation, Sang-gu Yoon, to offer the opening declaration of this Gyeongju conference.
여러분,
Good morning, everyone. I'm very happy to meet you and greet you all in Gyeongju, Korea. We are all experiencing a very tough time. It's agonizing and it's very difficult to understand, but from a different perspective, it can be viewed as an experience to broaden our horizons, so we should not be demoralized or lose courage. The future belongs to those who are brave, and we Rotarians are courageous when it comes to working for the future. Rotarians will lead all of us towards a better future. Today, in the presence of Rotary International President Shekhar, we have gathered to learn about challenges we are facing in the field of disease and environment. So we have gathered together for the 2021 First President Conference of Shekhar Mehta, and I hope that it will be a very productive and meaningful time for all of you. Thank you.
네, 다음
Thank you. Next, there will be a salute to the national flag. In accordance with the Rotary Protocol, we will begin by playing the national anthem of India, which is the home country of President Mehta, followed by the national anthems of Japan and Korea. Please rise.
모두
Please be seated. Next, past president of Rotary International, Lee Dong-keun, will offer the welcoming remarks on behalf of Rotary Korea. Allow me to take off my mask. Because we are on YouTube, I will read the welcoming remarks that I will have prepared. I ask for your understanding. Good morning. I would like to thank President Shekhar Mehta of Rotary International, fellow Rotarians, and distinguished guests for attending the Rotary International Presidential Conference. In particular, I would like to thank our distinguished speakers. To me, Gyeongju is a very special place that is near and dear to my heart. Yangdong Village here in Gyeongju is the home where I spent my childhood. It is the place of spiritual respite for me and served to help me become who I am today. Also, Koreans have expended quite a lot of time and effort to promote to the world this beautiful area where traditional Korean culture and landscape are well preserved. It is a great honor to be able to welcome President and Mrs. Mehta and fellow Rotarians to this meaningful venue. The world is in the process of overcoming the challenges posed by the global pandemic, but the issue of inequality intensified in that process. In the meanwhile, environmental issues are now a global challenge, and governments and companies around the world are making efforts to tackle the environmental crisis and to promote sustainability of our ecosystem. In light of this trend of challenges, Rotary has selected supporting the environment as its 7th area of focus. Such social changes and issues are expected to bring even more challenges and tasks to face Rotary. But I believe that in the hearts of Rotarians is a DNA that will help us overcome many a crisis that have evolved throughout the 116 years of our history, including the ability to face up to tremendous challenges, such as eradicating polio. I also believe that we have the strength and passion to spearhead the development and growth of Rotary going forward. President Mehta has said, "Service is the rent I pay for the space I occupy on this earth, and I want to be a good tenant of this earth." I believe that this statement exemplifies the core value and raison d'etre of Rotarians working together despite our differences in culture, generation, and areas of expertise. I sincerely hope that today's conference will be a meaningful opportunity for us to rethink the meaning and future of Rotary as a good tenant of this earth. Once again, I thank you all for coming. Thank you very much.
네, 직접 참석해 주신
Thank you very much for your beautiful words. Former President of Rotary International, Mr. Lee Dong-gon, thank you very much for personally attending the conference today as well. And now we will hear some welcoming remarks from the Director of Rotary International, Tatsuno Kazuhiko. Good morning, everyone. As introduced, I am on the board of directors of Rotary International. My name is Tatsuno Katsuhiko. I belong to District 2750 of Rotary Japan. And I am very honored to be given this opportunity to give you some welcoming remarks at the President Conference. And in Japan, we were excited and we wanted to participate in personally go to Korea, to Gyeongju to attend the President Conference. But because of the COVID-19 pandemic, we were unable to. So I ask for your understanding that we are greeting you just online. 8 years ago in 2013, Tanaka Sakuchi, who was the president of Rotary International then, opened President Conference in Honolulu, Berlin, and so on. And so After that, it's the first time that it's being held again here in Korea. And back then, out of 52 countries, more than 2,600 Rotary districts participated, and I attended the conference then. Kawatsuma Zero, who from Hiroshima, who was a former governor, worked very hard with his staff and colleagues to open that conference. At the Gyeongju President Conference, out of the 7 focus areas, we will be focusing on the environment and the treatment and prevention of disease. And I would like to thank Mr. Yoon Sang-gu, Vice Chair of the Rotary Foundation, and he asked that Japan, Rotary Japan, follow suit and prepare speeches on those 2 themes. And we have 5 people who will be giving presentations. From Ibaraki, there will be a presentation on ocean cleaning the ocean of plastic waste, which is polluting the marine ecosystem. So cleaning up the ocean and also preventing further pollution of the ocean is being conducted as a service project, and it is being led by the governor of District 2820, Arai Kazuo. And so that will be a project that we'll be introducing to you at the environment session of this conference. However, this project that I just described was not started by District 2820. It only received the baton last year, and I think that this project will be described in further detail during the presentation. At the Gyeongju RI Presidential Conference, I hope that through the presentation at the conference, with this project will continue to reach even greater goals in the future. Thank you very much.
Thank you very much. Next, President Shaker Mehta of Rotary International will offer his greetings. Please welcome him with a big hand.
안녕하세요.
Good morning.
How happy I am to be here with all of you. This is the first presidential conference of the year, and I'm so excited to be here. Yes, the excitement would have been far greater if there was one more zero to the number of people who are here. But this is the world we are living in. Man proposes, God disposes. But still, I'm happy that at least it is happening in person. We are so many of us here who are present here, and I'm extremely happy that the convener, my dear friend Yoon Sang-gu, has organized this so very well. Thank you, Sang-gu, for all that you do for Rotary, not only as the Vice Chair of the Rotary Foundation, but even as the convener of this event. Thank you so much. It's wonderful to see President D.K. Lee and his gracious wife, Yang Ja. What a pleasure it is to see you again with us, just as it is to see Yun Sun also. So it's a great feeling in Rotary when you meet your old friends. I'm happy Director Kim and his wife is also here. And I'm delighted that the Changemaker governors are all here. I had the opportunity of speaking to you individually yesterday, and let me tell you, what I heard from you has already delighted me, and my coming to Korea has become successful, knowing from you what your plans and programs already are. There are going to be 7 presidential conferences. This is the first one, and I had wanted that each of these presidential conferences focuses on 2 areas of focus. This one focuses on disease prevention and treatment, as well as on environment. 2 extremely important areas of focus for Rotary. So much so that if we look at the number of global grants done all around the world, the number 1 is disease prevention and treatment. The highest number of grants are given under the area of focus of disease prevention and treatment. That is because around the world, more than 400 million people still do not have access to proper health care. For us, health care seems to be available very easily, but nearly half the world, the healthcare system is broken. It isn't there. People do not get basic facilities of health. And so it is so very important that we need to stretch our hand to help those people, build their infrastructure, build their capacity to ensure that they too get proper treatment. They also have a right to live and live a life properly. Friends, if we go in certain parts of the world, we will find basic facilities of health is not there. Forget the surgeries that need to be done. Over the years, I have seen each year from India, 1 or 2, if not 3, medical missions go to Africa. Each time they go, they see tens of thousands of people there, and hundreds of surgeries are performed. And in the process, they are also building the healthcare system in those countries. The program of Family Health Days, which is done by nearly 350 clubs around the world, that's a Rotary Action Group. They do this program in Africa in nearly 10 countries, and they have done more than 5 million people have been affected because of that. Friends, the impact of this is huge. We can only imagine if there are no clinics here and there is no hospital here for 200 kilometers or even 400 kilometers. Imagine what would happen to you. And this is a reality in so many parts of the world. Rotary has done some amazing work, not just these health camps. In India, again, we do these health camps, and I'm aware, I see at one health camp, 100,000 people come. Or else we've done health camps with the Rotary Action Group, where in 25 different camps, we had more than 75,000 people coming over a period of just 3 days' time. We are now wanting to take this a step forward. On the other hand, Rotary has done an amazing job creating health facilities. So eye hospitals have been created, blood banks have been created, dialysis facilities are being created, cancer detection facilities have been created or upgraded. There are mobile vans which do healthcare, go out in rural areas, far remote areas, and help out people. Tremendous work is being done. And Rotarians across the world do, and I'm sure so many of you participate in them. Just last month itself, I was in Africa. I visited 7 countries, and I could see the healthcare system there is not good. It's not robust. At each of these countries, I met the president of the country, and in one country, I met the prime minister. To each of them, I have offered that we are ready to set up eye hospitals there. Fortunately, I have experience of setting up 19 eye hospitals myself in India and outside India. So I'm aware it does not take too much to set up an eye hospital, one eye hospital that can do cataract surgeries for nearly 3,000 people each year. So when I spoke to the president of Kenya, for example, I said, okay, we will set up the eye hospital provided you provide the building. We will not invest money in the building. We will put the equipment and we will run the hospital. He said, Mr. Mehta, how many hospitals will you set? I said, how many buildings will you give? So that is where we are, friends. I have promised to them that we will do those global grants, and I have done one part there, the other part I'm doing here. And I leave this message to Director Kim as well as to you, my dear friend Sang Kuyun, and the RRFC who I met this morning. How about stretching a hand out to our African brothers and sisters? How about setting up an eye hospital in each of those countries? How about setting up a blood bank there? How about setting up dialysis facilities there? They do not have these facilities. It is important that we go and help our people across the world. When India faced problems of polio, America was helping from half the world away. It's important that today, when we need to help Africa, we should be able to, and we will do that from India, let's do it from Korea, from Taiwan, from America, from Australia, all of us, we should try and help out, set up the healthcare system. To me, this conference, this part of the conference where we are talking of the healthcare issues, if this is one goal that we can achieve, so that in those 7 countries that we have visited and the others where there is a need, we can set up eye hospitals, set up other facilities like blood banks, dialysis centers, or any other medical facility that they require, I think the purpose of this conference would have been well served. To me, every conference should lead to an action, and I think here is a ready action to all the changemaker governors. I request you, think in terms of doing, you are number 2 in giving to the Rotary Foundation, which means you have a lot of DDF. Use that DDF for doing good in this world halfway across the world. People who do not have the facilities, how about doing some global grants? One each of the districts, even if you did one global grant, I think it will be a big boost to the healthcare system itself in Africa, in different countries of Africa. Moving to the other part of this conference, which is environment. And I'm so happy I missed out Director Tatsuno. I'm not seeing you here, so I missed you out. You are such an important part, and I'm sure so many other people who are watching it online. This is also getting live streamed. To all of you, a big hello. I wish you all were here. But okay, that'll be for some other time, maybe at Houston, or who knows, before that at some other presidential conference or at some other institute. We'll surely meet up, but we'll definitely meet in Houston. Coming to the other part of this conference, which is the environment. For years, Rotarians have worked for environment, but they have not directly worked on it. When we were doing water sanitation, environment was a part of it. If we did literacy, at times environment was a part of it. Environment was nearly all permeating. But surveys showed that more and more people wanted to join Rotary for doing service projects, and the number one thing that they were concerned about was environment, especially the younger people. They wanted to work for the environment. And so, as the demand grew, as the Rotarians themselves became more concerned, and as climate change became one of the biggest issues in the world, Rotary took the smart step of bringing this as the 7th area of focus. Starting this year, we can do global grants, we can do programs and projects, and I'm very happy that you yourself are doing some wonderful projects and programs. Japan is doing cleaning of the ocean, which is going to be a project that I'm going to see day after tomorrow. The same thing, cleaning up of all the beaches. A big program was held a few days back. There is so much that can be done as far as the environment is concerned. We can plant millions and millions of trees. Last year in India, one district said, we will plant 1.2 million trees, one for every Rotarian in the world. If one district can do it, I'm sure many other districts can do it. This year itself in India, we'll be planting more than 5 million trees. And I'm sure that's just one country. I'm sure around the world, if we gathered the data, we would have planted millions and millions of trees. And we keep doing it each and every year. That's one of the basics and the very easy things for us to do, but it has a long-lasting impact. Say no to plastic. It's a big program. Around the world, say no to plastic is becoming bigger and bigger because people are realizing the problems of using single-use plastic. Recycling of the plastic. Using alternate energy, solar energy, wind energy. There is so much that can be done. Friends, environment is so very important for us. At times we try to neglect it and see what the result is. Today, the pandemic. So, in a time when the pandemic has affected all of us, it is so very important that the two subjects that you have chosen are directly connected with the pandemic. Disease prevention and treatment, and the other, of course, is environment. If we try to not to take care of our environment, there is going to be other issues that will come up. Today it's the pandemic, which is corona. Tomorrow it may be something else. We need to all put our resources together so that we learn to live with nature. That is how it was built. That is how the world was built. The nature, we need to be living with other creatures. We need to understand plants, trees, flora, fauna, animals, all of these, friends. That is our ecosystem, and we cannot destroy it. I'm very happy that today we are going to focus on the environmental issues. It's very important that we create awareness. Children in school need to start understanding from the very beginning. Our next generation should understand that climate change is not a thing in the future, it is today, and we need to do something about it. Friends, once again, let me compliment all the people who've been part of organizing this wonderful event. I'm so very happy, Sanku, that the two topics you have chosen are so relevant today in times when we are all struck by the biggest menace that we have ever faced in this world. But Rotarians are resilient. When we find a problem, we also try to find a solution. And let this conference be one step towards finding that solution. Thank you very much. Namaste.
네, 다시 한번 인사.
Once again, a big thank you. Please give a round of applause to thank President Mehta. Once again, a big thank you to President Shekhar Mehta, as well as our former RI President Lee Dong-gon, and also RI Director Tatsuno Kazuhiko. Once more, I'd like to repeat the announcement that this event is being live streamed on YouTube. If you type in the keywords 2021 Rotary International President Conference, you will be able to view this event live, and I hope that you will tell other fellow Rotarians around you about this event that is being live streamed. And now we'll move into the session proper. Today, we'll be focusing out of the 7 areas, focus areas, 2 focus areas, disease prevention and treatment and environmental preservation. And we will be hearing from experts from Korea and Japan. First of all, we will hear some Korean presentations in the field of disease prevention and treatment. And we will start with the presentation from John Linton, who is the director of the International Healthcare Center of Severance Hospital of Yonsei University. And he will be talking about differences in healthcare concepts between the East and West. And we have prepared the video, so let's watch it.
Linton. I work at Severance Hospital under the Yonsei University Healthcare System in Seoul, Korea. Our center is the International Healthcare Center here in the hospital, and our hospital is a 2,500 bed, very large tertiary university care center. The title of my talk today is Differences in Healthcare Concepts Between the East and the West. I am very sorry to say that I'm going to switch into Korean because my understanding is the greater audience is listening in Korean. 다시 인사 올리겠습니다. 연세대학교 세브란스 병원의
Once again, I'd like to greet you again. My name is John Linton, and I'm the director of the International Healthcare Center of Severance Hospital of Yonsei University in Korea. Today, I will be talking about the differences in healthcare concepts between the East and West. I'll try to make my presentation brief but rich in content. First of all, regarding the Severance Hospital of Yonsei University, it was started by Dr. Allen, who brought in Western medicine or modern medicine from Korea into Korea for the first time. And Minister Min Young-ik was sustained severe sword wounds by Japanese assassins in 1885, and Dr. Allen successfully treated him with modern medicine, and that created the foothold for Western medicine to grow and advance here in Korea. In the West, scientific approach is everything in medicine. Who am I? What is the problem? And how am I going to solve this? So self-identification, and problem resolution are very important in the scientific approach for Western medicine. And one of the things I felt when working here in Korea is, well, 95%, even 97, 98% of patients are good patients. They don't create problems. But there are about less than 5% of the patients are difficult patients, and how you satisfy them is the crux of medicine. And we can't share religion, but we share an ideal philosophy. ASK, A for attitude, and S, skill. With skill, high skill, we have to win the confidence of people. We have to dress well and neatly, and knowledge is also important. K is for knowledge. Well, it's not the most important, but it is something that we basically have to have in order to be good doctors. I've been working here in Korea for 30 years, and one thing that I can really feel is the curse of being big. If you think big, sometimes you fall into the curse of losing the details. You don't treat the patients like patients. You treat patients like patients, not like family members, and you become indifferent. And the biggest problem is anybody and somebody and nobody. So you think that somebody will do it, but nobody does it in the end. So our goal is to make nobodies into somebodies who will take action. And continuing with the comparison, the concept of medication. In the West, medicine is a toxin. So it's a necessary evil, but it does harm to your body as well. But in the East, you have the concept of yin and yang, and you want to address the imbalance of yin and yang in your body. So in the East, the more the better when it comes to medicine. So people like medicine, like taking medicine in Japan, in Korea, in China. People seem to like taking medicine. But in the West, the emphasis is on the scientific approach. It has to be evidence-based medicine. Does this have effect? Well, 30% of patients think that even if you grind a table into powder and make medicine out of it, it will have an effect. That's the placebo effect. So in the West, it has to be a scientific approach to medicine, but in the East, science-based medicine is just one of the alternatives. If you have appendicitis, of course you have to go to a surgeon, but besides that, Science-based approach is just one of the many alternatives. And another important difference between the East and West is about informed consent. So in New York, for example, if you have signed on your driver's license, if you are in an accident and you are pronounced brain dead, then 2 neurologists will just harvest all your organs for organ donation. But here in the East, although the attitudes are changing, your family members' consent is more important than your own consent. And telling patients of what they are suffering from, well, everything is told to the patient directly, although, of course, not everything all at once. But in the West, you tell the patient directly the morbidity rate, you have how many years to live, and so on. But in the East, you don't tell that to the patient directly. You explain things to the family members. And one of the biggest factors that caused misunderstandings when I started working here in Korea was, well, after coming back from studying to be a doctor and we're starting work here in Korea, I thought that American nurses were better than Korean nurses because they provided total care to all the patients. But if you look at the ICUs in Korea, the Korean nurses are as good as the American nurses. If the family members are out of the scenario and behind closed doors in ICUs, Korean nurses were just as good. And I make the recommendation that you should have a professional caregiver rather than depending on your family members when you're bedridden and you're unable to go to the restroom on your own. And another big difference is in payment systems. In the West, you pay after you receive the medical service, but in Korea, you have to pay beforehand, before you receive treatment and before you even meet the doctor. And I thought that this system would end up closing down the hospital. So I introduced something called the midway payment. You pay in the middle of receiving the medical treatment, midway in the process. And one thing that Korea seems to badly need is more reforms in the healthcare. I know that the IMF, when we came under IMF stewardship, it was very difficult times, but we need more reforms, especially in the healthcare industry, which seems to be very socialized here in Korea, if you want to put it in negative terms. And so we need to create the Hallyu or the Korean wave for the healthcare industry, and this kind of socialized system could be an obstacle. So in medicine, is medicine a basic right or can it be a privilege? At the UN, it says that healthcare is a basic universal human right. So personally, I think that the national universal healthcare insurance can be a safety net for everyone, and anyone can receive such basic healthcare, but private health insurance can be taken up by those who want more privileges. So if we want to attract more patients from abroad to come receive treatment in Korea, to develop the health industry and health tourism, then this could be a stumbling block. And so we have to start stressing quality over quantity for such people that we want to attract from overseas to come receive treatment. And another thing that we find lacking is the lack of national stars to attract international patients. And those who come from overseas to receive medical treatment, they want specialized services. Wealthy foreign patients want high-quality services. But in the socialized medical system here in Korea, there is a worry that I might receive lower quality services from the guy next door. But here I want to stress what you call the Robin Hood spirit. To get those who are well-to-do, those who can afford it, to pay as much as possible and then distribute that to the poor. Why don't Saudi kings come to Korea for treatment? We need more than just high quality treatment and universal treatment. So we need to benchmark successful countries who have raised and advanced their medical tourism system. So we need to think more than just philanthropic. We need to think of medicine as something more than a philanthropic endeavor. That would be a big mistake. It's an industry, and we need to attract, we need to find ways to attract more wealthy patients, international patients. So there are many ideas that we are floating, such as attracting Korean Americans to come to take advantage of the more inexpensive treatment, medical services here in Korea. And so we can go together. And there are many ideas that we can offer, packages that we can offer, package services, one-stop services, and travel packages. And the future is bright, I think, because Korean doctors are very skilled, and we have top medical devices and equipment. So I think we have the foundation to advance the medical tourism and medical industry here in Korea. Thank you very much for listening. Yes, thank you.
이야기를 해주신 인요한 한국
Thank you, Dr. John Linton, for that very interesting presentation.
그래서 코로나19의 건강 영향 및
Next, Professor Jae-wook Choi of Korea University's College of Medicine will deliver his presentation entitled The Health Impact of COVID-19 and Global Solidarity. Good morning. My name is Professor Choi of Korea University. It's a pleasure to be able to address you today. The topic of my presentation is the health impact of COVID-19 and a threat to global solidarity. Before I begin my presentation, let me start off by saying that at the present time, it is too early to evaluate one way or the other the impact on health that COVID-19 has had. There's not yet enough scientific evidence to evaluate the impact of COVID-19. What are the implications of COVID-19, and what are the roles to be played by international organizations such as Rotary International? That's what I would like us to think about today. As of the 15th of this month, globally, over 500 million cases have been reported. The number of deaths is 4.6 million. The Americas, North, South, and Central Americas had the highest number of deaths reported, as well as the rest of the world being hit hard by COVID-19. As for excess mortality, which is deaths from other illnesses, that has increased. There are many reasons for this because doctors were focused on COVID-19 for one reason or another. Excess mortality grew, and issues such as suicides increased globally, which is a great problem. Excess mortality is reported to be more than 3 million, and the number of unreported cases is said to be very high. Not only is the health impact of COVID-19 tremendous, because the medical system is too focused on tackling COVID-19, there are areas that are being overlooked. If you look at the figures regarding excess mortality, the US, Russia, and other areas where there are high numbers of population show high rates, as well as Peru, Mexico, and Bulgaria, and other developing economies who have vulnerable medical systems are showing spikes in excess mortality. The UN and WHO had announced that by 2030, certain Sustainable Development Goals, or SDGs, would be achieved. These are important goals the world has been working together to resolve. But both the UN and WHO have expressed pessimism on whether SDGs can be achieved by 2030. The progress toward these goals is lackluster. That can be seen in many areas, such as children's health, women and girls' health. The situation is worse than before COVID-19 began. And because the focus is on COVID-19, other infectious diseases such as malaria, tuberculosis, and HIV are spiking once again. So this is a manifold problem. So access to COVID-19 tools, in other words, a program to support developing economies to improve access to COVID-19 tools has increased. This can be divided into 3 pillars or areas: diagnostics, therapeutics, and the healthcare system to oversee all this. Through building these pillars, we want to support developing economies. It's not undertaken by the WHO alone. Many international NGOs such as Gavi, the World Bank, UNITAD or UNITAID have risen to the challenge. So this is an example of the global solidarity and effort. However, the situation is not easy. It's far from easy. The vaccine inequality is an important issue, as you are aware. 500 million doses of vaccines have become available worldwide as of date, but the beneficiaries are mostly in the rich economies, such as the US and Europe. Most of the doses administered are in leading economies, whereas the least developed economies and the developing economies are not seeing the number of doses administered increase. WHO has established the COVAX program to provide vaccines to developing economies, but it will be in 2022, in other words, next year, when vaccines become universally available in developing economies and mid to low income countries. Till then, COVID-19 will continue to wreak havoc, which means that with the high number of cases, naturally the number of variants will increase. And if you have more variants, then this threatens the leading economies where most of the population have already completed their vaccination. So this goes to show that having just the rich economies and their citizens vaccinated is not enough to solve the problem. We need vaccination universally, globally, in order for us to truly start living with COVID-19 globally. This is why global vaccine supply is important. Let me talk to you about the Korean situation. Korea is known for K-quarantine, which is characterized by the 3T strategy: test, trace, and treat. Based on our experience of MERS back in 2015, through public-private partnership, we have worked with developers to release almost the world's first PCR kit that offers easy diagnosis of COVID-19. So this is how during February, March, and April last year, we were able to effectively manage and keep down the number of newly confirmed cases. As you saw in the chart, during the same period, the number of cases and deaths skyrocketed in countries such as the UK, but in Korea, the figures were not so high. One of the benefits of Korea is universal health coverage. We have a strong social security system, which is not to be found in many places around the world. All Koreans receive the same health benefits regardless of income, and there is zero out-of-pocket payment. In other words, the public medical insurance guarantees that the state covers the entirety of your treatment expenses. Now let me wrap up my presentation. COVID-19 has caused trouble globally, and this could be an opportunity for global solidarity. It could be a threat to dismantle global solidarity that we have built up until now. As for how to plan the post-COVID-19 recovery or how to plan the post-COVID-19 resilience programs, this has been discussed by OECD members, among others, and a key point was proposed by the relevant OECD committee. The rich economies can undertake their own resilience programs, but the low to mid-income countries as well as the least developed economies require a different approach. Back in May and June this year, the WHO General Assembly was held to discuss these matters, and various efforts of global solidarity and the future direction of WHO were discussed. Many experts say that the international community shall fight against COVID-19 through solidarity and cooperation. We don't know yet who the final winner of the COVID-19 pandemic will be because it's still ongoing, but the evaluation criteria will be as follows. Until now, the whole focus was on the number of confirmed cases, but going forward, it will be the number of deaths per population rather than the number of confirmed cases. And as I mentioned earlier, excess mortality, in other words, deaths from causes other than COVID-19, as well as health damage, will be important indicators. And we also need to think about the magnitude of economic and social impact caused by COVID-19 and the social assets of humanity, which is democracy, freedom and liberty, and solidarity. These have all been undermined. The historic assets built up by civil society have been damaged by COVID-19, and this should also be measured and taken into consideration. Last but not least, this is a photo that shows where the UN Security Council is currently. The hegemonic struggle between Russia, US, and other superpowers threaten to undermine the governance of international organizations such as the WHO. This goes to show the difficulty that we must tackle. International NGOs such as Rotary International have a long-standing history of undertaking important programs, charity, among others, and this is where your effort is needed. Let us think about what we can do together. Thank you.
네, COVID-19 팬데믹.
Thank you. That was an important presentation with implications for all of us. Dr. Choi emphasized the importance of international solidarity and cooperation.
So what do we have in line next? Next, we will have a presentation entitled Disease Treatment and Rotary by President Nam Sung-hee of the Daegu Health College. She was the 2005 to 2006 District 3700 governor in Daegu, and she is also currently heads the Korean Council for University Education. Let's meet her online.
Hello, I am RI District 3700 PDG Sung-hee Nam. It is my great honor and pleasure to be a guest speaker for this special event. Today, I'll be talking about the role of Rotary International in fighting various diseases around the world. In this long-lasting pandemic, I am, with a heavy heart, bringing this issue, but I think it is crucial that we as Rotarians to ruminate our roles and duties to help in fighting disease and saving lives. From now on, I will switch to Korean. 여러분 안녕하십니까? 국제 로터리 3700 지구 전 총재 남성입니다.
Hello, my name is Nam Sung-hee, PDG of RI District 3700. Today, at the RI President Conference of Shekhar Mehta, I'd like to talk about the relationship between Rotary and fighting disease. As you know, infectious diseases sometimes become so severe that it threatens lives. And these diseases could be endemic, depending on the climate and environment of the country affected, or it could be so infectious that it stops human activities. All human activities come to a virtual standstill. That is what is happening right now with COVID-19. This picture shows how COVID-19, the coronavirus, is spreading throughout the world. This coronavirus is shutting down national borders. So much so that if you look at the number of flights that were happening before COVID-19, you can see that the lights have virtually disappeared after COVID-19. Every time we open our eyes in the morning, we ask ourselves, so how many have been confirmed cases today? How many cumulative confirmed cases? How many deaths? And how do the variants emerge? As you can see, we are experiencing the fourth wave of this pandemic with a huge spike in confirmed cases. But despite all these obstacles and difficulties, our activities have not come to a standstill. We're not stopping our actions. In December of 2020, the board of directors of RI have come together with the Foundation, to form a joint task force team. And we are distributing vaccines when vaccines were still very new. And we have launched communications campaigns to encourage people to become vaccinated. And we are also spreading good habits such as frequent hand washing, social distancing, mask wearing, and so on. And under the leadership of President Holger Nack who said that Rotarians have a successful history of stepping forward to take action when the world needs our help, we have always taken action. And we have a successful history in that we have almost eradicated polio. And that is a global initiative that we have formed to build an infrastructure with our partners. And we are garnering it and harnessing it to fight COVID-19. In 1905, going back to the story of ending polio, Dr. Ivar Wigman discovered that polio was an infectious disease that you can contract without showing any special symptoms. And because of polio, so many children had to use crutches, and we had to cut down so many trees in order to make these crutches. And then in 1955, vaccines were invented, and this is the result. Since Rotary launched its End Polio project in 1985, this is the result. As of last year, we have only one case each in Afghanistan and Pakistan, down from two-digit figures of polio cases. But even this one case of polio in a country means that we have to continue to supply vaccines. So we have continued our actions. As of January 2020, we have renewed our partnership with the Bill and Melinda Gates Foundation. How? We have pledged to raise an additional $450 million in funds to end polio in 3 years. And the Bill and Melinda Gates Foundation promised a matching fund for every $2. For every dollar we raise, they will match it with $2. So with that, we will be able to raise $150 million a year. That means in 3 years, we will be raising an additional $550 million. And with this, we have reached 99% of our goal, and we will have the final push to 100% completely eradicate polio. And so currently we are providing programs such as mobile phone text messages to find out where children need vaccines and how to get vaccines to them. It is very saddening that the Taliban have taken over Afghanistan, and this has made it very difficult to continue our project in Afghanistan. But we need to formulate strategies to get vaccines to children there. Another very important project that we are involved in is in the focus area of saving mothers and children. Rotary makes high-quality healthcare available to vulnerable mothers and children so that they can live longer and grow stronger. The mortality rate of children under 5 is currently 6.3 million a year, and the main cause of infant death and children's death is malnutrition and diseases that you contract from unsanitary environments, like a sore on your lip that spreads and eats up your entire face. And all these diseases result from no clean water and no clean healthcare facilities. So Rotarians are trying to address this problem through immunization. In Korea and in developed countries, you have a schedule for immunization to immunize your baby against all kinds of diseases like measles, malaria, pneumonia. And we are doing that in other countries as well. Health education for mothers to teach them how to breastfeed, to prevent infant mother-to-infant HIV transmission, and providing clean drinking water and sanitation facilities. The next focus area would be health of women, including pregnant women. And in sub-Saharan Africa, 1 out of 39 women die from complications during pregnancy and childbirth. That means 1 woman out of 39 who die from a disease or complications that could have been prevented if she had received adequate medical examination and treatment. So Rotary provides medical staff with medical equipment for deliveries and also mobile clinics. And we're distributing contraceptives and also information on how to use them. So in that way, we're sponsoring certified programs to fight ignorance. And President Shekhar Mehta has added environment as a new presidential theme, and we are also working very hard in that area. For example, to address the problem of 2.5 billion people who live without sanitation, like flushing toilets or clean public bathrooms. So we are trying to address poor sanitation and the lack of drinking water, clean drinking water. And so, as you know, about 1,400 children die every single day from guinea worm disease or diarrhea because of lack of safe drinking water. So we Rotarians are playing the role of building restrooms equipped with septic tanks and building facilities to store rainwater, and we use sand and coal to make simple water filters to provide clean drinking water and to prevent waterborne diseases. And we also try to spread sanitary habits like washing your hands frequently. The first ever Rotary community service that is related to sanitation was started by our great founder, Paul Harris, in 1907, building public restrooms in Chicago. Chicago did not seem not to have such public restrooms back then. And we are also fighting many other diseases. We are providing grants to support projects to fight diseases around the world. And the grant that is injected into fighting diseases is 76 billion Korean won. And you add to that grants from Rotary clubs, and that would be a very big fund. And with that fund, we are fighting malaria, HIV/AIDS, Alzheimer's, multiple sclerosis, and these days also substance abuse and misuse. And we are helping to build infrastructure for cooperation among doctors, patients, and governments. So there are hundreds of healthcare projects that are being led around the world by Rotary. And I would like to pay respect to you for your service to change lives. And may you continue to serve to change lives in the future. Thank you very much. Yes, thank you. To John Linton, Dr. Choi Jae-wook, and also Dr. Nam Song-hee for the presentations from Korea. And we will now move on to some Japanese presentations, also in the area of treatment and prevention of disease. So let's take a look.
Next, we have Japanese speakers' presentations lined up on disease prevention and treatment. First, former chair of Foundation, Motegi Satoshi of District 2750 of Tokyo, Japan, will give a presentation on the donation of multifunctional ultrasound medical vehicles. Good morning. For the past 4 years, I've been working for the Rotary Foundation, and I am a member of the 2750 district of Tokyo, Japan. Thank you for giving me this opportunity to present to you today. Now I will begin my presentation. An overview of the project, which is called Multifunctional Ultrasound Medical Vehicle for the Tainan region. The area of focus that is relevant is disease prevention and treatment. The project length is from 2019 until 22 or 20. And this also involves District 3500 of Taiwan, the Tainan Madu Rotary Club, District 3470 was also part of the effort. Hunkaya Onjo Chichibu Yori Fukaya Hirashi Kawamoto Minato Nagato Honjo Minami Fukaya Nos Rotary Clubs all participated. The recipient country provided cash, the aiding country provided DDF, and there was additional funds from WF. The total costing $99,976. This area is located on the southwest side of Taiwan. There are 36 administrative districts. The red spot is Changgun, which is west of Tainan City. It's an area that borders on the coast. According to statistics until 2018, the population is 19,000, and about 21% of the population is over the age of 65. It is one of the 6 areas where the average population age is highest in Taiwan. There are only 3 medical clinics, so there is a shortage of medical resources. If you look at this project, Tainan, Changgun needed this multifunctional ultrasound medical vehicle, which we donated to a clinic in the vicinity. This photo shows the exterior and interior of the medical vehicle, which is equipped with portable ultrasound and ECG equipment, and a doctor and nurse team are on board to do a tour of the villages each day of the week. Villagers who do not have access to clinics can visit this vehicle where they can receive diagnostic services. And through regular follow-up or checkup, residents can guarantee a healthy life. Older residents living alone or special needs individuals get the medical staff to visit their homes because they cannot readily visit the vehicles. And through the head of the village, we have information on people who are vulnerable and in need of social welfare services. We can also provide support in terms of daily expenses. There's also health screening and health counseling to enhance their health knowledge so that their quality of life will be improved. When it comes to asthma or diabetes and the right diet for diabetics, as well as prevention of multiple sclerosis. These are all areas covered by these sessions. As for the major outcomes of operating this vehicle, as of February 2020, we acquired the license from the authorities of Tainan, and a total of 66 tours were made. 3,175 people received services. 54 cases when it comes to applying for global grants. It's important to have coordination between the donor country and the recipient country. Close communication is required. By having meetings, you can build trust, and afterwards, the application process for the grant can take place smoothly. For the implementation of this project, let me talk to you about the importance of human communication and cooperative relationships. In a manner of speaking, Mr. Isao, the District 3902, he is the head of the Friendship Committee there. And from 1991 until 1995, he studied in a university in Japan. And in 1993, he was the scholarship recipient. And the Honjo Rotary Club provided support in terms of scholarship, and he served as a coordinator in this project. The Honjo Rotary Club member, Mr. Takayuki, he is also the past governor of this district. In Kaohsiung in 2007, there was a friendship exchange meeting. And this is where the two individuals met for the first time in 23 years. And when he visited Japan once again afterwards, through introductions made by the governor of the district, the project was launched. As the chair of the club, I was aware of the benefits of the grants. So I asked Governor Murata for a favor. The Honjo Minami Rotary Club member, who is also an assistant to the governor of the district, made sure that all the clubs in the group could participate in this project. And he was also the liaison in applying for the global grant. So he wore many hats, and his efforts were vital in the success of the project. From January 16th until 19th, 2019, a joint team of Rotary members from Taiwan and Japan met with medical staff. They also visited 5 villages in the area. So we were able to look at the site where it was proposed that patient treatment take place. We also witnessed patient treatment in progress. Among the older population, some could speak Japanese, so they said thank you in Japanese and shook our hands. That left a great impression on my mind. Not just the recipient country, but also the Rotarians of the donor country could see for themselves the fruits that their endeavors were able to create. In conclusion, Rotarians are people of action. Only those who act can bear fruit, and the Rotary Foundation exists to assist your actions. We were able to reconfirm this message once again through this project, and I wanted to let all of you know about the benefits of this project. Thank you for your time and attention.
이치로 공직
Thank you very much, Mr. Motegi Satoshi, who is the former chair of the foundation. The District 2750 of Tokyo is a sister district of the Seoul District 3650, where I belong. Next, what do we have next?
다음은
Yes, next, we will hear a presentation about the joint project that was spearheaded by the RI2 District 2630 of Kihu and Mie in Japan and RI 3330 of Thailand. And the presentation will be made by Mr. Shinohara Kazuyuki of RI District 2630.
第2630地区
So District 2630 in Japan, Kihu and Mie, that's where I come from. My name is Shinohara Kazuyuki. Thank you very much for inviting me. It's an honor to be part of this event. Rotarians at District 2630 have been partnering with the RI District 3330 of Thailand in a joint project for disease prevention and treatment. And the theme of this session, treatment and prevention of disease, is the theme and aim of our project, so I'd like to talk about these projects. First of all, the joint project with the District 3330 of Thailand. We completed a Krabi, in the Krabi hospital, the donation of very highly efficient medical equipment. The Nurses Rotary Club took charge of this project, and the total budget was $36,000. The Krabi hospital is in Samplat City, which is a famous tourist city. But despite that, they did not have enough first aid equipment, particularly to treat patients with cardiopulmonary arrest. There needs to be very fast first aid treatment, and for that you need video laryngoscopes. And so this was the need that we identified in the area. And so with that, we started the project. And if you look at the content, there are patients where intubation is very difficult. So we have the video laryngoscope and the AED defibrillator and highly efficient resuscitators. We provided those equipment. So we have equipped hospitals with the AED defibrillator. And thirdly, we have provided professional training programs for the nurses and medical staff so that they will become familiar with how to use the equipment that we provide. And we try to continue to sustain the effects. So we have plans for after service and post training, and we're also providing supervisory and monitoring programs so that we can ensure the continued impact of this project. And we also have a mother and child care project. We are providing cutting-edge equipment to the Sampran Hospital. The Tajimi Riverside Rotary Club, District 2650, was in charge, and $60,000 was the budget of the project. In this region in Sampran, the infant mortality rate is very high, and we wanted to lower that mortality rate through our project. So, and we provided training programs for the medical staff as well. And if you look at the content of the presentation of this project, we have the incubator for infants in the neonatal ICU, and oxygen inhaler, and infant jaundice phototherapy devices, and stethoscopes for infants. And secondly, in order to provide high-quality services, we have accessory medical equipment that we have equipped the hospital with. And we're also providing professional training for medical staff, and also mother and child lessons and programs. And we are also providing maintenance services through local companies. And we are also monitoring the program and also providing further financial support so that the impact can be sustained over the years. And we're also directly monitoring and supervising the use of the equipment and also programs. But we're doing this remotely because of the COVID pandemic. And this project was actually aired on television. And we were moved by the genuine happiness on the faces of our beneficiaries. And the second grant program that I was talking about was really impactful, and it was a really good program, doing good in the world. There are so many people who are still waiting for us to reach out to them to do good. Countless Rotarians are taking action with affection and passion. And I hope that this kind of work will continue in the future through your hands and through your projects as well. Thank you very much for listening. Yes, that was a presentation on the joint project by districts 2630 in Japan and 3330 in Thailand. Next.
볼리비아 수두증
The next presentation is on the project to help heal hydrocephalic patients in Bolivia. Good morning. My name is Shinjiro Tohi of Higashi Hiroshima 21 Rotary Club. The District 2710 of Rotary International has undertaken a hydrocephalus treatment and relief project in Bolivia, South America since 2004. During the past 17 years, we were able to save the lives of more than 1,300 hydrocephalic patients. The project began back in 1999 when a Rotarian and Japanese resident of Bolivia, Mr. Yukio Hasegawa, visited a pediatric clinic in the city of La Paz, Bolivia. A 5-year-old child was in this pediatric clinic who is smiling in this photo. And the child's mother said, "My child is no doubt going to grow up to be very smart because look at the size of her head. It's huge." At the time, not much was known about the illness called hydrocephalus, and thus many children lost their lives because no one thought of getting treatment for them, because no one knew to. Bolivia is a multi-ethnic country which is an inland state located almost in the dead center of South America. Its landmass is threefold the size of that of Japan, and its population is about 11.5 million. Currently, its per capita GNP is a little over $3,000, but in the early noughties, when this project began, it was one of the world's poorest countries, with a per capita GNP of $1,000, or 1/30th that of Japan. This is a photo of a hydrocephalic child. The disease features a large-sized head and lack of energy. Hydrocephalus is either a congenital condition or caused by infection when the fetus is inside the mother's womb. Sometimes the child is born with this condition, sometimes it is not. In some cases, the child acquires hydrocephalus after birth due to meningitic infection. 3 out of every 1,000 children born in Bolivia are born with this condition. This is a CT scan of the head. The photo on the left shows the abnormal filling of fluid in the cerebral ventricle. This pressurizes the brain and causes many symptoms. Treatment of hydrocephalus is called shunt surgery. This is surgically implanting a catheter called a shunt into the brain to divert excess cerebral spinal fluid away from the brain. The surgery requires the use of valves to prevent reflux of the fluid. In Bolivia, hospital stays and surgeries are covered by insurance, but not the purchase of this valve. This valve is not covered by insurance, which cost $370 back then. The average monthly income of a Bolivian worker at the time was less than $100. Most people could not therefore afford the valves, and this is why many children with hydrocephalus were unable to receive surgery and therefore lost their lives. This is why Rotary began to undertake this project. This project is not just about providing valves. First, we began an awareness-raising campaign about this illness to increase the level of knowledge among local residents. When we first began this project, many Bolivians were not aware of hydrocephalus. They did not know what it was. What you see here is an awareness-raising poster, which we displayed in City Hall, as well as various government offices and clinics, as well as in advertisements we took out in local newspapers. This is a signboard on the road to the airport. It says, 3 in every 1,000 children have hydrocephalus. Rotary provides valves necessary for treatment of this illness. This is how we actively raise the local community's awareness of hydrocephalus. Then we screen patients, and if they met the criteria, we purchase the valves, which we deliver to the clinics. This is a child and mother awaiting surgery. This project began in La Paz, Bolivia in 2004 and spread by 2011 to the entire District 4690. The 22 clubs in Bolivia participated in this project, and over 170 members dedicated themselves to this humanitarian effort. This is footage of the actual surgery. General anesthesia is administered. A small incision is made on the side of the patient's head, and through this incision, a catheter is inserted to connect to the cerebral ventricle. To prevent reflux, a small plate is attached to the catheter to insert subcutaneously to the abdomen. This draws out the excess cerebral fluid from the ventricle to the abdominal cavity. Post-surgery, the patient is placed under observation in the ICU. This surgery helps to prevent cerebral damage, and the patient prognosis is normal development of intelligence. Every year, 70 to 80 patients undergo this surgery in Bolivia. We are helping save many children's lives. The Higashi Hiroshima 21 Rotary Club is of a modest size. It was founded in 2001. And along with Saijo Rotary Club, which is its mother club, we had 6 grants applied for, as well as global grants from July 2004. So over the course of 13 years, we were able to provide 1,004 valves. In May 2017, a commemorative ceremony marking the 1,000th valve donated was held in La Paz, Bolivia. We're happy that one small Rotary Club in Japan was able to save over 1,000 children's lives in Bolivia, which is located on the opposite side of the globe from Japan. District 2710 saw multiple clubs apply jointly for the global grant to mark the 100th-year anniversary of the foundation. Over 20 clubs joined in the effort. As a result, we were able to provide valves for 415 patients worth $164,000 US. An agreement was signed between District 4690 and Chuquiago and Marca Rotary Club of Bolivia. Miss Maria is currently 13 years old. She was born prematurely at 7 months with symptoms of hydrocephalus, and through Rotary's hydrocephalus treatment project, she was able to receive surgery. And now she has grown up to become the best student in her class with the highest academic grades. This Japanese-Bolivian resident and Rotarian Yukio Hasegawa is the person who was behind the beginning of this project. And in recognition of his contribution, he was the recipient of the Rotary Service Above Self Award in 2016. To this day, this octogenarian continues to provide this humanitarian service. Bolivia has a large population of children. Over half the population is below the age of 14. However, infant and child mortality figures are still high, which means that many children are still losing lives. We Rotarians must continue to reach out to the world so that such children can benefit from getting the right treatment. Thank you.
Next, we'll hear a presentation from the Governor of District 2750 of Tokyo, Mr. Miura Shinichi. He will be talking about the RI District 2750's Global Grant Project on COVID-19. So let me begin the presentation on our activity. It is a presentation of the global grant project on COVID-19 taken on by District 2750. It was participated in by almost all the clubs in our district. This project focused, first of all, on supporting the hospitals in Italy. And second, we had the second project where we carried out a project in Naperville, of Illinois, where we focused on equipping hospitals in this region with medical equipment. And there was also another one where we also provided similar medical equipment. And for the first project, we provided the 28 hospitals with stretchers and also the thermal scanners, as well as triage unit. DDF, WF, and the club's donations all totaled 1.3 million euros. And it was through that strong network of Rotary that we were able to continue with this project very quickly. In about 2 to 3 weeks, we were able to initiate the project, and it was completed in about 5 weeks. So let's look at a video of this project.
During this emergency, the 13 Italian Rotary districts, including more than 900 clubs, responded to the crisis with a coordinated strategy, focusing on disease prevention. With the Rotary Italia project, Prevention to Defeat the COVID-19 Pandemic, worth €1,300,000, we want to offer to 28 hospitals in Italy, which are directly involved in the fight against COVID-19, an innovative technology package to minimize the risk of infection of healthcare workers and interrupt the virus transmission. The project aims at equipping each hospital with 2 thermal scanners to instantly detect the presence of fever, a COVID triage unit, an isolated cabin where it's possible to safely perform triage, and a stretcher for transporting the infected patient by protecting the healthcare staff from exposure to the infection. The project aims at responding to the most urgent needs while providing tools that could help healthcare facilities in the long term as well, in the event of another spike in infections or for future research and development. Rotary connects the world, says our motto this year. With this project, we want to allow the world to be able to safely reconnect again in the next future. Together, we can bring positive change to our communities. Together, we can save lives.
The second is a project to provide remote medical treatment as well as communication for remote areas. So for nursing facilities as well as home care facilities, we have provided IT equipment so that they can talk remotely with their family members. So there were 4 districts that were involved, and more than $20,000 was injected into the project. And including WF, there was more than $84,000 that was injected. The Hiro Rotary Club in Japan also participated. The biggest funder was Japan and had spearheaded the Global Grant Project. And we were able to be the lead in this project because the requirement for the funding was lowered from 30% to 15%. With the past rule, we're not able to become the lead in a global grant program, but thanks to the easing of the requirement from 30 to 15%, we were able to spearhead this global grant project. There were some pictures, so please take a look at these pictures. The third project is from Narita to support medical staff. To provide personal protective equipment and anti-infection suits to the medical staff, to the hospitals in Narita near the Narita airport. And so one district and one club in Japan and many other Rotary countries came together, and to the total of $36,000, including WF, was injected into this project. The Tokyo Hiro and the Naperville in the United States, those were the two Rotary districts that headed this project. And there was an exchange of the benefactor and beneficiary project, and it is a very good project that exemplifies the international cooperation in Rotary. So these are some pictures of the project. Thank you very much for listening.
이번 회장 컨퍼런스의
So one of the two focus themes for this President Conference was disease treatment and prevention, and we have heard all 4 Japanese presentations now. Thank you very much to all the presentations. And if not for the COVID-19 pandemic, we could have met all these speakers in person, but we were not able to, and I ask for your understanding. We'll now move on to the second theme,
주제 발표.
which is supporting the environment. Again, speakers from Japan and Korean Rotary are standing by. The presentations from Japan will begin first. The Global Environment Support Project on the Rotary Day of Volunteer, hosted by District 2820 of Ibaraki Prefecture of Japan, is the topic of the next presentation. Governor of District 2820, Kachuo Arai, will offer an overview of the project, to be followed by a presentation by the honorary member of Hagwon Rotary Club, Masahiro Amano, on the topic of global environmental issues and cleaning up the coasts, which will be followed by a discussion session between the two gentlemen, Governor Arai and honorary member Amano. This will last about 40 minutes. Let's take a look at the video.
Hello, Rotarian. Namaste.
Good morning. My name is Arai, and I'm the governor of District 2820. Let me introduce to you today the Global Environmental Support Project on the Rotary Day of Volunteering hosted by our district. The seventh area of focus of Rotary International is supporting the environment, and President Shekhar Mehta has said or proposed the idea of setting up a Rotary Day of Volunteering. So we at the district of 2820 had a plan to clean up the coastal area and invited other Rotarians to participate. And many fellow governors agreed wholeheartedly to this proposal, and a total of 34 districts in Japan worked with Governor Miura to work as one team, Team Japan. And Governor Kuwazawa kindly set up a dedicated website where we recruited volunteers, and we were able to get over 30,000 volunteers from all over the world. And on September 12th, the districts did a global Rotary Day of Service cleaning up the rivers and coasts. This is how the project began. The global environment is changing organically. So let me begin by talking about where we are in terms of the global environment and what we can expect in the future. Starting from the adoption of the Kyoto Protocol, Dr. Masahiro Amano was involved in the process from the establishment of the Kyoto Protocol. Dr. Amano, good morning. I had heard that global Rotarians are working to clean up the coastal areas, and let me talk to you about what your efforts will bring. Of course, it helps fight ocean water pollution, which is an important part of the global ecosystem. The global ecosystem is deteriorating because population is increasing, the economy is developing, and capital increase leads to various issues. Of course, economic activities, if they could expand exponentially, infinitely, there would be no problem, but the reality is resources are limited. Fossil fuels will run out at most in the next few decades, 100 years at most, and use of fossil fuels leads to environmental degradation. Economic activity based on fossil fuels, such as petroleum, will one day lead to the destruction of human civilization. Protecting human civilization is not a currency traded on the world market, unlike the price of coal or oil, which is determined by the cost of acquiring or excavating such resources. Such intangible cost is called social cost, and then the question is, who will bear the social cost? Who will pay? First of all, the relationship between various environmental issues. The blue box denotes the anti-ocean environment pollution efforts you are involved in, which directly is related to maritime organisms. It has also a connection to the climate, which I'll get to later. Climate change is at the center of environmental issues. The Paris Convention was widely reported in the news. This leads also to freshwater issues, as well as deforestation, desertification, and other issues. So maritime pollution is most closely connected to decrease in biodiversity and climate change. So among these issues, because of time constraints, I will talk about climate change today. Natural resources or resources depletion. How can we understand these issues? What you see here is Our Common Future, a report issued by the UN back in 1987. For sustainable development, in other words, not just the economic development of the past 50 and 100 years, going forward, what can we anticipate? An important keyword for the world is sustainable development. This was pronounced by the UN Commission back in 1987 under the title of Our Common Future. Without undermining future generations' need for resources, we must fulfill or meet our needs. What does this mean? Let me talk to you in the context of climate change. You see the land mass of ice in the Antarctic region, which on the left is from the 20th century, with the photo on the right is from 2020. If you look at the yellow line, this is the average mass of ice. Back in 1991, it's almost identical, but as of September 2020, the size of the ice has visibly shrunk, and only in the space of 3 decades. The size of the ice has shrunk visibly, which goes to show that the global environment is changing for the worse dramatically. Also, global warming, which I'm sure you have heard a lot about. Back in 1990, this was the forecast for the future. The greenhouse gases or CO2, methane, and others would increase, and emission of these gases would increase global temperature. That was the prediction back then. Now, this is no longer a prediction. As you can see, these days, the climate overall has increased. It's very hot these days. The red area denotes the very hot days or high average temperature days. The red part shows that almost all the regions in the world are red. In other words, global climate increase is no longer a prediction, it's happening, it's here today. Next, concentrated rainfall, heavy rainfall, or heavy precipitation. If you look at the areas subject to heavy precipitation, it's mostly in the northern hemisphere. The 2 points show where precipitation has slightly increased. The 3 points denote where precipitation has increased by a large margin, and so forth. The red areas coincide with the 3-point or 3-dot areas, which goes to show these areas are not only getting hotter, they're getting more rainfall. This means that ocean temperatures are increasing. Otherwise, heavy rainfall would not increase. So right after rising temperatures, there's heavy precipitation. Now we're looking at drought figures. Drought is not taking place globally, but still, drought is increasing the world over. As you can see, climate change that is unprecedented is taking place at an alarming rate. Global warming or climate change is here. It's a real problem. Here you see greenhouse gases. Back in 2007, the IPCC, or the Intergovernmental Panel on Climate Change, issued a report issued by researchers. I was one of those researchers that issued a report for the IPCC. Here you see that the CO2 density compared to 10,000 years ago has rapidly increased. It's begun to rapidly increase only recently. I'm blowing up the figure after 1880. In other words, after the Industrial Revolution, CO2 emissions rapidly increased. The same goes for other greenhouse gases. 70% of greenhouse gases is CO2 or carbon dioxide. And on this chart, from 0 to the top, you see warming. If it's below 0, it means that the areas are cooling down. With the rapid increase in CO2 emissions and after 1990, the phenomenon of higher temperatures and heavier precipitation have started to be observed. So every 6 or 7 years, the IPCC issues a report. The most recent one was the 5th report of the IPCC, which said that previously, the odds were 95%, but this recent report, the fifth report, says that it's not a probability of 95%. The problem is here. It's happening now. If you look at this chart, the figures again are rapidly increasing. During the past millennium, it was pretty stable, but recently it's rapidly increasing. On the right-hand side, you see a chart that shows CO2 density increase, methane density increase. If you take those two out, you're left with the blue part, which is pretty much even. So after 1850, if greenhouse gas emission had not increased, the line would have been pretty much at a standstill. But because greenhouse gases have been artificially increased, the orange line denotes that greenhouse gas emission is rapidly increasing. CO2 emission is done by humans, which means we can control or decrease CO2 emission. Here you see on the top, the brown line, which is very high. The second line is high. The third line is middle. And the blue line is low. The light blue line is very low. So these are the 5 scenarios with which we can predict future temperatures. According to this scenario, well, the future is what we make of it. What we choose now will determine which scenario actually comes to pass. Depending on what we choose now, we can affect how global temperatures change. Here you see global temperature change, and on the right-hand side, you see how much the temperature changes by each scenario. What the 0 denotes is from 1850 until 1900, the average temperature change is 0. So we begin with the baseline of 0 degrees temperature change. And will this line stay at 0? Will it increase at a rapid rate, or would it increase gradually? That choice is up to us, what we choose to do. Temperature after 2050 will be widely discrepant. This goes to show the level of damage future generations will have to face. We cannot stop climate change or global warming altogether. The blue part is about 2 degrees Celsius change. The Paris Convention determined that we want the outcome to be 2.6 degrees Celsius. So 2 degrees and 2 degrees. But this means that the island states will disappear. They will be submerged. So we have to take into consideration the light blue line, which is 2.5. So the light blue line is where the Paris Convention drew the line, so to speak. So you see the CO2 emissions, it should be brought down to 0. Right now, it's more than 0. We're up to 400 ppm. So we want this brought down to 0. What can we do to bring CO2 emission to 0? The vegetation, both on land and the oceans, must absorb some of this. This absorption capacity. Starting from the left, you see the absorption capacity, very low, low, middle, high, and very high. Again, 5 scenarios. The very low part is where the total emission, which is the black line, and the remainder remains in the air. On the far right-hand side, if you see the very high scenario, because the CO2 density is high, there are absorption capacity available, but still, even with all the absorption, there's still a high concentration of CO2. In other words, atmospheric temperatures will increase. Let's take a look at the ratio. We can see where the bulk of the CO2 went. As you move on to the right, CO2 absorption amounts decrease. So how can we make this happen? First of all, the oxidation of oceans and plankton's capacity to absorb CO2 decreases. So in the very high scenario, the absorption levels decrease. And another thing, if agricultural land increases, that means there's less area for forestation, which will absorb CO2. So as you can see, climate change is highly important. It is at the smack center of all the issues we must tackle. As for the ocean environment, I'm sure you share my understanding that it is highly critical, oxidation and microplastic issues. If we have more microplastic, the maritime ecosystem will only deteriorate, which will undermine biodiversity and aggravate climate change because it reduces nature's ability to absorb CO2 emissions. So having said all that, how should we respond? Human security. This concept was first raised and discussed in the Environment Summit back in 1992. And safety and security until this point was at the state level. But security is not restricted to national borders. This is a global issue, requires cooperation among countries to guarantee human security. Therefore, security extends not just to individual states, but global citizens. Then what should we do? Disputes, poverty, lack of sanitation, education, healthcare services, all these must be tackled. Human security is eliminating risk of conflict, supporting refugees. Refugees are increasing in Africa, the Middle East, and Afghanistan most recently. Also, there's the issue of how to extend support to poor countries. Poverty eradication is important. Japan has an aid agency called JICA, and also through its NGOs, we are tackling poverty. In the past, people used to say that there are plenty of poor people in Japan. Why should we extend our reach globally? But this is missing the point. Other people are global citizens just like Japanese. So this concept of global citizen, not just protecting the people within your borders, is expanding. We also need to provide education globally, not just inside our borders. Rotary International has the word international in its name. And I believe the Rotary mission is in alignment with what I've just said. Human security. If you think about security of the state, your vision becomes myopic. With a myopic approach, you cannot resolve global issues because globally, poor countries are seeing deforestation because that's the easiest and quickest way to increase food supply. But deforestation undermines the ability to absorb CO2 emissions. So protecting human environment and increasing human capacity is a very important part of environmental protection. Enhancing human capacity means people have the wherewithal to choose what to do. Poor people don't have such a choice. Poor countries are focused only on increasing the food supply. Once they've reached a certain level, they can turn their eyes toward protecting the forest. So this is why we want to assist the poor countries to broaden their horizons. This is also the mission that Rotary has set out to do. Supporting the environment requires all of our effort. So this is why I believe you are all engaged in a very important endeavor. This is the end of my presentation. Thank you very much. Dr. Amano, thank you for the wonderful lecture. Listening to your speech, we understand that the global environment is at a crisis. Unless we change the way we act now, the future for our younger generation is bleak.
Well, let me ask you a question. Rotary talks about diversity, ecosystems, and inclusivity. So this is the focus areas, and we will be focusing on that is equality and the ecosystem, protecting the environment, and so on. So how can these themes translate into Rotarians' actions? Yes, as I mentioned just now, there are so many different kinds of people around the world. And if they all focus on one single problem or issue, we could reap great results. And that's what Rotary can do. Rotary International, with its network of many countries, can help do that. So one country's wrongdoing can actually have a very bad impact on the rest of the countries. So we want to harness the international network of Rotary. And I think that Rotary can play a very important role, like, for example, cleaning up the ocean, where all people of diverse nationalities can join in. Secondly, I'd like to ask a question. Something that we Rotarians can do very well. Our district has a friendly relationship with a district in Nepal. And Nepal, you have, because of icebergs melting, you have glaciers melting, you have a glacier lake, from melting glacier water, made up of melting glacier water and also accumulated silt. And this has led to floods, and which has wreaked havoc on the surrounding villages. And we have identified that the cause of the problem is rising global temperatures and the rising temperature of the seawater. And so we want to create a friendly ecosystem that is commensurate with the eco-friendly living habits of the people there. And so together with relevant UN agencies, we have initiated a program for protecting the ecosystem there. And I think equality is a very important theme. Let me start there. Listening to the Nepal story, I've done a lot of studies on Nepal. And to the Nepalese, what do they think of the future? We initiated a survey on that. There was a 14-year-old villager, girl who lived in a village. What is your future dream? And we asked her that. And the first answer is, dreams, you dream at night. What is the relationship between dreams and future? I don't have such dreams. What I want to be in the future? So what do you want to be in the future? Well, it's been decided for me. I'm 14 years old, but my future husband has already been decided. I'll be marrying him this year. So doing housework and giving birth to children, that is my future. That is what I am destined to do. So listening to those answers, well, when I asked the same question to Japanese children, they have so many answers. And the answer that I heard from the Nepalese girl really made me realize what little choice they have. So many, we have a lot of choices, but there are people living in different areas of the world where they don't have much choice about their future. Another thing I want to emphasize is, when it comes to global warming, people think that they have no choice. But we do have options available to do something about global warming. So this kind of inequality exists around the world. So we have to think about that inequality in addressing climate change. Regarding inclusivity and enhancing equality, what can Rotarians do in terms of the ecosystem? First of all, when we do environmental preservation activities, we seem to think that only some special people can do it. But we have to get rid of such thinking. It seems that we seem to think that people in poor countries, they can't do much for their environment, but that's wrong. There are things that we can do. There are things we can do for developing countries and poor countries as well to encourage them to reforest the environment. And so if we think of this as a global problem, we are in the same position. We are exposed to the same problems. So we have to think on the same page. And I think this is very close to the spirit of Rotary, where as many people as possible can come together to address the same problem. Because the environment is a problem that involves many people and many different countries. Like, for example, desertification and pollution is a problem in China, and marine pollution is a problem in another country, and some other problems, other countries face problems of a lack of biodiversity. So these countries should all come together to address this same problem. So inclusivity is a very important characteristic of the solution that we have to come up with to address climate change. So I hope that Rotarians can play a big role in this. Yes, thank you very much for your very important words. I hope that you enjoyed this presentation and discussion. As you know, the planet Earth needs the activities of Rotary in education programs, training programs, and also assistance programs in order to contribute to the capacity of poor countries and developing countries to address the problems of ecosystems in their area. And we need to take action in order to preserve the planet and ecosystems for future generations. And this is a new focus area through which we can really, Rotary can really contribute to changing lives around the world. And so I hope that you will be able to listen to the call of the times. Thank you very much.
인상적인 발표를
Thank you very much, Governor Arai, as well as Honorary Member Amano. Next, from Rotary Korea, presentations on environmental protection. The first speaker is the former Environmental Minister of the Republic of Korea, Dr. Myung-ja Kim, on the topic of whether climate change is an existential threat. She was the former Environment Minister of Korea. Currently, she is the president of the Seoul Forum for International Affairs, president emeritus of the Korean Federation of Science and Technology Societies, as well as serving as the chairman of the board of directors of Hyosung Corporation. Good morning. The topic of my presentation is the climate change an existential threat? The answer is yes, it is an existential threat. Back in 2008, there was a report predicting what would happen by 2025, which was actually quite accurate, other than the fact that the pandemic was not taken into consideration as a possible risk. You see the various drivers working together, leading to uncertainty. And I think I can safely say pandemic belongs among those drivers of risk. Then, what is an existential risk? An event that could cause human extinction. What is the biggest risk humanity faces? They are twofold. On the one hand, They are anthropogenic risks, or risks created by humans. And there are risks that are created by nature, or non-anthropogenic risks. Among anthropogenic risks is global warming, and natural risks include pandemics. Regarding climate change, there's what you might call an interesting series of cartoons. They all carry important implications. The fourth picture shows what we must do to resolve the climate crisis. It's quite a detailed picture. The World Economic Forum, at the beginning of each year, issues a global risk report. In 2021, the report shows, in terms of shock and the probability of occurrence, there are certain risks, and among them are failure to adequately respond to the climate crisis. What are the risk factors that aggravate the global risk? There was a survey on this point, and the survey showed 9 factors, and the cause of those 9 aggravating factors were outlined in the survey. The IPCC, or the Intergovernmental Panel on Climate Change, compiles scientific data and literature to summarize important conclusions. Climate is increasing. In 1850, prior to the Industrial Revolution, temperatures were at a certain level, and after the Industrial Revolution, how was the global temperature affected? It is increasing. It's getting higher. Then there's an accompanying chart, which is CO2 levels in the atmosphere, which is shown in blue. Starting from 1900 to this day, how much CO2 has been emitted? Tremendously, according to this chart. But there's an important fact here. There are industrial economies that increase the qualities of their citizens' lives. They're mostly located in the northern hemisphere. Their CO2 emission levels are well above and beyond those of the southern hemisphere. If you look at this map, it shows that the areas of the world that suffer from the consequences are in the southern hemisphere, which has yet to achieve the level of economic development to increase the quality of lives for its residents. There's a study on accumulated emission levels by state. In 2005, China's emission levels surpassed that of the US because China is often called the world's factory. In 2009 alone, CO2 emissions in terms of ranks start with China, the US, Russia, Germany. For every person or per capita emission, China's figures are less than half of the US. Per capita CO2 emission levels, the higher they get, the higher the quality of living. And the per capita CO2 emission was studied. If you have a large manufacturing sector, you have a lot of CO2 emission. Also, if you're an export-oriented economy, that state that's the exporter is emitting the CO2, but the goods produced by emitting the CO2 were used in other countries. So the CO2 emission per capita is shown in red, and the darker the red, the higher the per capita CO2 emissions. Another important fact is in states with low CO2 emission levels per capita with similar standard of living. In the case of France, the ratio of nuclear energy is high, and this leads to lower per capita CO2 emission. Also, countries who have high levels of renewable energy usage have low levels of per capita CO2 emission. Another important fact, African countries, in comparison to the high emitters, they emit less than 1/100th of the high emitters. In other words, there is little, if any, economic development in this area. So, depending on what type of energy was used in economic development, this leads to differences in CO2 emissions. Which economic sector is accountable for how much CO2 emission? Hydrogen, power generation. For each sector, technologies must be used to reduce CO2 emission levels, and most importantly, the question is the less energy you use to increase production, the more energy efficiency you have. And currently, the level of energy efficiency among countries is highly divergent. And to create the same level of energy, how much CO2 did you emit? That's also a wide-ranging answer. The higher the level of technological innovation, the more energy efficiency you have, which means that France is one of the lowest emitters and one of the highest energy efficient countries. This chart was a bit complex, but those are the key points I hope you will remember. Globally, there are 9 tipping points which also interact. So currently, we're at a highly risky situation, and this impacts a large part of the global population. Having said that, is there a way to resolve climate change? Yes, but it will not be easy. Increasing energy efficiency is most important. We must step away from fossil fuel. We must increase the use of renewable energy. Nuclear energy can contribute to this to a certain extent. And the international society has set for itself the 17 SDGs. We can solve the climate change issue by achieving the SDGs. So in every step of production and consumption, we must work toward achieving the SDGs. In technology and industry, the least developed economies have basically little, if any, infrastructure or basis for them to achieve this. So going forward, the social systems and technologies that are at a tipping point, we must work to bring about a positive result. And because these risk factors are mutually intertwined and interact, we must work against this. Thank you very much for your time and attention.
김명자 전 장관의 발표.
Thank you, former Minister Kim Myung-ja, for your presentation. We are live streaming this event on YouTube, and many Rotarians are joining us online. Please search for the event on YouTube. The keyword would be 2021 Rotary International President Conference. The next presentation will be given by Professor Choi Jae-chun, Professor Emeritus of Ewha Women's University, and he will be talking about the eco-vaccine and the imbalance of biodiversity imbalance and eco-vaccine, and he was the first director of the National Institute of Ecology, and he got his doctorate in biology from Harvard, and he is also famously called the ant doctor or ant professor. Hello. Coronavirus pandemic, which is commonly called COVID-19, is the pandemic that has become an unprecedented catastrophe sweeping across the globe. I visited the WHO website recently, and more than 200 million people have been infected, and the death count is over 4 million. And this, from a perspective of a biologist like me, is really absurd. Because virus is not even a living organism. It cannot sustain life on its own. So it is not even a living organism. It's just a fragment of a gene. But humanity, the Lord of all creation, is being devastated by this fragment of a gene, and so it's really absurd. But what choice do we have? So many lives have been lost because of this virus, and global economy is in the pits. According to an article in The Economist published a few months ago, the article said that perhaps we might be understating the death toll of COVID-19. Because if there is someone who has suffered for a long time from a disease and dies because of pneumonia, which is a complication of the disease, then the cause of death is recorded as pneumonia rather than the disease that the patient has been suffering from for a long time. So actually, if you count such cases, the death toll could actually rise to 1.3, rise to 13 million actually. So studying nature is my profession, and I can say that sometimes that in a way we have treated nature with too much complacency, and that we are suffering the results of that. And so it's very encouraging, and I'm also very grateful that this very important problem and issue is something that Rotary International, with its global networks, is actually focusing on. You are known for your influence in terms of global service, and so I'm very encouraged by that. So if we regard this as the result of the fundamental attitude that we have towards the environment, and if we think of this as the cause, then our efforts should not stop at just fighting COVID-19. I know that we are going through very difficult times, and what I'm about to say might sound very unnecessary and things that we don't want to hear, but I can say that the coronavirus will not drive humanity to extinction, because once the virus has killed enough people, then there will be natural distancing between people, and the virus will not be able to infect any more people. Just like the pest, the virus was not a virus, it was a bacteria, but the bacteria was only able to kill 1/3 of the European population. Only, the word only might sound absurd, but the pest was not able to kill all the people that were living in Europe back then, because it could not infect any more people after a certain period of time. So pathogens could be terrifying, but these pathogens cannot erase humanity from the planet Earth. But this is not the case for environmental degradation. We see with heat waves, floods, wildfires. This is all caused by climate change. But we can't hide from climate change the way we can hide from pathogens, viruses, and bacteria. And climate change has the power to wipe the very last person from this planet. I'm very apologetic to say this, but we are learning lessons at a very great cost. So if you use the analogy of college education, we're paying very high tuition, very big tuition to learn this very expensive lesson, that even greater tragedy awaits us. So we have to rethink the relationship between nature and humankind. If we are able to think in that way, thanks to COVID-19, then I believe that we have to be really earnest in thinking about climate change, which is the cause behind behind COVID-19 as well. So personally, I believe that we have to think even beyond climate change and think about biodiversity, which is an inseparable issue from climate change. Biodiversity is a more worrying and serious problem. Let me do a biologist typical calculation. Biologists calculated this about Homo sapiens. Homo sapiens have been living on this planet for about 250,000 years. For the first 240,000 years, we were barely surviving on the plains of Africa. And we were running away from wild beasts, and we were barely surviving. But for the last 10,000 years, when we entered agricultural societies, we have been growing exponentially, explosively, and we have covered the entire planet. If we do the calculation, we go back to 10,000 years ago, and we add up the total weight of humans and the farm animals that we bred, the livestock, then we humans and our livestock took up about only 1% of the species, living species on planet Earth. But after 10,000 years, if we do the calculations again, 7.8 billion people multiplied by 60 kilograms, and the weight of the cattle and poultry, the livestock, cows, pigs, chicken, and duck that we are breeding, we take up 99%. And we have reduced the rest of the living species to 1%. And this imbalance in diversity will lead to catastrophe. Pathogens that are living and parasitically on wild animals as hosts, if they find it difficult to survive, almost always they will migrate to humans or the livestock that humans breed. And this will lead to catastrophes. When I'm asked who is the person I respect the most, I say Pope Francisco, even though I'm not a Catholic. And in 2019, Pope Francisco talked about ecological sin. And he said that he will include ecological sin in the original sin of humanity. I'm not a religious person, but if I translate the Pope's words in my own way, I think the Pope was saying that everything on this planet was created by God. So everything is God's creation, and just one of these creation, because we are the strongest, and you know who I'm talking about, Homo sapiens. Homo sapiens are trying to play boss or play God, and is plundering and killing the rest of God's creation. When God created all creation to be equal, will that make God happy? What would be original sin if not this? That would be the way I would translate the Pope's words. So in the past 1 year, looking at the havoc that COVID-19 has wreaked on the world, I want to talk about ecological turn, and that is the central theme of the recent book I wrote. And scholars talk about the great transition that civilization is going through. It is a great transition of civilization, but they're not specific enough about what kind of turn this is. This is not the information transition. It is not a transition of technology. It is not a transition of robots. It is a transition that it will be a matter of life and death for humanity. If we do not rethink the relationship between ourselves and natural ecosystems, then we will not be able to survive, and we will be accelerating our own extinction. So we have to look at this ecological turn. We call ourselves Homo sapiens, which means that we know how to think, but I disagree. I don't think we're smart. To be really genuinely smart, then we have to be humble enough to take into account and coexist with the rest of living species. We have to become not only Homo sapiens, but Homo symbios. Ecological turn is the only way for humanity to survive. Thank you very much.
Once again, thank you, Dr. Jae-chun Choi. I'm looking at the real-time response on YouTube. Many Rotarians are saying that they're sending kudos to President Mehta and the Rotarians who are attending this conference in person. The next presentation will be given by Director Byung-sung Chun of Korea Environmental Corporation on the topic of environmental disaster. He is the former presidential advisor for environment in the Republic of Korea and also the former head of the Korea Meteorological Administration. Good morning. The topic of my presentation today is environmental disaster, water contamination. Can we resolve these issues? What kind of a world do you wish to live in? We hope for a peaceful, prosperous, and safe society full of love. That is a long-standing ideal of humanity, but the world is quite different from our dreams. Peace, prosperity seem to be faraway goals. We are working hard to achieve those goals. One of the goals we should continuously work toward is protecting the environment. The environmental issues threaten global ecosystem and humanity, and it is an issue that must be resolved if humanity is to have a future. As you're well aware, climate change is said to be the 21st century's game changer. What we do to combat climate change will determine the future of humanity and the world. The same goes for the water issue. Water shortage and water pollution, as well as maritime pollution, are serious issues. 97.5% of water on the Earth's surface is seawater. Fresh water is only about 2.5% or 1.5%, and with the exception of icebergs in Antarctica, the accessible or usable water for humanity is only 0.3% of the global water supply. And this water is being threatened. Climate change leads to drought, flooding, typhoons, rising sea levels, deviation in precipitation. Precipitation levels are highly divergent among different regions, and due to more industrial water usage, we are experiencing water shortage. Water demand is increasing. People want to use more and more water. The problem is water shortage is intensifying the world over. As you're well aware, the UN's 2030 SDGs address water shortage. According to the UN, 2.3 billion people don't have enough water, and 330 million people are facing serious water scarcity. With population increase, urbanization, and industrialization, we have more wastewater. And with higher use of fertilizers and pesticides, land pollution, as well as pollution of rivers and oceans because of plastic waste, are now threatening human safety. Of the world population, before the Industrial Revolution, 1/3 of the world's population lived in cities, but over 68% of the global population now lives in cities. Industrial production and urban crowding leads to more water shortage. The average income the world over went from $445 in 1960 to $11,000 in 2020. Of course, it's good news that people are more prosperous, but with population increase, urbanization, and industrialization going full force, water shortage only intensifies. That is the fundamental problem. Now let's take a closer look at the state of water pollution. Urban wastewater, industrial wastewater, animal waste are three leading sources of water pollution. In Korea, we have made many efforts to combat water pollution, monitoring water quality, building animal manure processing plants. Astronomical amounts have been expended to solve the problem, but still we don't have satisfactory water quality. To this day, in summer, when water temperatures increase, there's serious eutrophication. Management of non-point pollution sources is also difficult. To increase agricultural production, we use fertilizers and pesticides. Such use of fertilizer and pesticides leads to higher levels of nitrogen and phosphorus in water, which leads to eutrophication, algae, and also another important risk factor is oil spills. If there's an oil spill by oil carriers, that compromises the marine ecosystem. In 2007, oil tankers clashed off the western coast of the Korean peninsula, leading to massive oil spills and threatening to bring about annihilation of the maritime ecosystem. Rachel Carson is known for her book, The Silent Spring, back in 1973, which highlights and warns of the dire impact of human activity on the natural environment. With the publication of The Silent Spring, the U.S. introduced a change to its environmental policy. President Kennedy formed an advisory commission on the environment, and in 1969, a national environmental policy was enacted. Also, Earth Day was established, but still, use of pesticides and fertilizers only continues to increase. The fertilizers used to increase agricultural production did contribute to increasing the food supply, but at the same time is causing water pollution. In 2020, about 200 million tons of fertilizer was used worldwide. And again, this leads to increase of nitrogen and phosphorus in the water, which in turn leads to eutrophication, which is a measure of water pollution. Another important source of pollution of water is the use of plastics. The use of plastics has drastically increased since the 1950s. It's now at a size of 750 billion tons. And most plastics are of a chemical structure that cannot easily be dissolved by microorganisms. And the amount of reusable plastic is very small. So this leads to the piling up of plastic waste in seawater, in the river. The University of Georgia in the U.S. published a paper that studied the tremendous amount of plastic waste released into the water. The same goes for Korea. In 2020, 3.2 million tons of plastic waste was generated. Humanity fishes and then fills the void it has left with plastics. It's quite ironic. 70% of maritime waste is plastic. And every year, the amount of plastic waste is only increasing. And such plastic dissolves, leading to microplastic. It does not dissolve completely, and microplastics in the world's oceans negatively affects the maritime food chain, which in turn brings dire results on humanity. The issue of synthetic fiber is also serious. Synthetic fiber is extracted from petroleum, in other words, polyester, acrylic, and nylon. When you wash these synthetic fibers, you get microplastic released into the water. 1/3 of maritime microplastic stems from synthetic fiber, which is a shocking fact. Such microplastics feeds the food chain, accumulates in the bodies of fishes and other animals, and returns to haunt humans. The world is currently up to its chin in terms of the problems it has buried itself in. Perhaps it might be too late, but maybe it's not. In Genesis of the Bible, God, in order to have the world start anew, wiped the world clean with flooding, and those in Noah's Ark were able to survive and start afresh. Perhaps it is time for us to build a strong second Noah's Ark. A pro-environmental policy, development of pro-environmental technology, as well as global solidarity and citizens' participation, all will go into building the solution. Rotarians, with their international network, must lead the effort. I wish you the best of success and the highest level of contribution to this effort. Thank you.
오늘
A big thank you to former Minister Kim Myung-ja, Professor Choi Jae-chun, and Director Chun Byung-sung. A big thank you for your presentations on the environment. Lastly, we will watch a video created by Rotary Korea.
환경 보전에 관한
We enjoyed all the presentations by the speakers from both Rotary Korea and Rotary Japan on environmental preservation. A big thank you again to all of the speakers for their very in-depth presentations. Now we'll proceed to the closing ceremony for the President Conference. First of all, for the closing ceremony, we will have a reading of the declaration or Rotary International President Conference Gyeongju Manifesto. Mr. Seo Chang-woo, Governor of District 3650, and Governor Bang Mi-yeon of District 3750 will be coming up together to read the manifesto. Today, we celebrate the start of the 2021 Rotary International President Conference. The conference is centered around the themes of disease prevention and treatment and environment, which are two of Rotary's 7 areas of focus. Unfortunately, due to the COVID-19 pandemic, invitations to physically attend this conference, comprising special lectures from world-renowned experts and honorable Rotarians, were strictly limited. Accordingly, we are broadcasting this conference online to Rotarians and non-Rotarians around the world. Today's event is being held in Gyeongju, South Korea, the royal capital of the ancient Silla dynasty, with a 1,000-year-long history. It would be very meaningful for us to think together about the present and future of humanity and the mission and role of Rotary in this beautiful and historic city of Gyeongju. Therefore, the organizing committee of this year's Rotary International Presidential Conference has taken the adoption of the Gyeongju Manifesto with its focus on disease prevention and treatment as well as environmental preservation as an opportunity to imbue the 1.2 million Rotarians worldwide with renewed determination to work together to set common goals and to promote service as an active act of humanity. Through this 2021 Rotary International Presidential Conference, we Rotarians express once again our deep interest in the prevention and treatment of various diseases, including COVID-19, which has become another challenge to our world, and in the state of the environment, the newly added 7th area of focus for Rotary, which we believe is a serious and urgent problem for all of us. Therefore, we Rotarians hereby declare as follows. First, regarding disease prevention and treatment. First, recognizing the reality that 400 million people around the world do not have access to even basic medical care, we will actively participate in public welfare projects to build basic healthcare facilities and services for the poor and sick who do not have access to medical care. Second, given our interest in overcoming the COVID-19 pandemic that threatens our world today, we will use our global Rotary network to increase the provision of quarantine supplies and vaccines to underprivileged communities throughout the world. Third, in particular, we will put our best efforts into raising money for the Polio and Vaccine Fund so that the polio eradication project, which we have been carrying out for the past 35 years and which is so close to achieving its goal, can be completed as soon as possible. Regarding the environment, first, understanding that the natural disasters occurring all over the world are caused by the degradation of the environment, we will work together in cooperation with international organizations and related NGOs to overcome our climate crisis. Second, we will work in partnership with Rotary International's 524 districts and 36,811 Rotary clubs, as well as Rotaract and Interact clubs, to plan and implement broader, more sustainable, and more impactful environmental service projects. Third, we share in the Rotary spirit that the environment is the common heritage of humanity that we must preserve and will actively donate to the newly created Environment Major Initiative Fund. In addition, by taking the lead in our personal lives and in our business and professions, we will start creating a new wave of change that will stop global warming and environmental degradation. 2021 October 5th, 2021, Organizing Committee of the 2021 Rotary International President Conference, Gyeongju, Korea.
Thank you. Following the manifesto, President Shekhar Mehta of Rotary International will offer his comments and words of gratitude. Please welcome President Mehta with a warm round of applause.
Can you hear? Yeah. So we've come to the end of this first presidential conference. It had to be short, both in the number of people as well as the duration. The initial data that we had collected was that each of these presidential conferences will have more than 1,000 people. It'll be on 2 areas of focus, and it'll be at least for 2 days. But looking at the conditions that we are going through today, it shows how important it is for disease prevention and treatment. Short it might have been, but it was very useful. The presentations, I think, were outstanding, one after the other, whether on disease prevention or on environment. Both of them brought forward the importance that was expected out of this event. Also, I was very happy to see some of the projects that are being taken up. That is one of the ideas. And also at the end, the manifesto that you have come out with, that's extremely important. What's the way forward? We have discussed about disease prevention. And of course, Rotary's mainstay has been disease prevention. The polio program itself is one of the best things that Rotary has done. It's an amazing, amazing program that we have done over the years. Even today, I get goosebumps to think that we are just about to eradicate polio. For the last 8 months, we have not had a case in Afghanistan or in Pakistan. 4 more months, and we are nearly there. So disease prevention or treatment has been our mainstay for the last 35 years plus. And that was just for polio. Apart from that, we do so many things. We probably run hundreds and hundreds of hospitals, hundreds of blood banks, so many facilities for cancer, so many facilities for hospices and dialysis and diagnostics and different things. Wherever the need has been, Rotarians have come forward. We've gone into the rural areas, we've gone into far-flung areas, tried to bring treatment there. But of course, our programs will now have to even become bigger, better, and bolder. And as I mentioned to you, I keep telling everywhere, Rotary now has to play a role in the nation-building process. There may not be a need in your country for a nation-building process, but there are other countries where you can help in the nation-building process. And I would urge you, this conference will be hugely successful if we can start doing that as far as disease prevention is concerned. As far as environment is concerned, we all are afflicted by it, whether it is the advanced countries. In fact, they are the ones that are more afflicted than the countries who are not so advanced. So charity will begin at home. We will have to lead by example. We ourselves will have to start caring for the environment even more than what we are doing today. And I'm very happy at the manifest that you've agreed that these are the things that we wish to do. Not only will we try to do preventive, but curative also will have to be done because the damage has already been done. Also awareness, advocacy, which we are extremely good at because of our network, because of the leadership network that we have, the reach that we have, because also of our reach because of the polio work. I think we are in an excellent position where we can go and speak to the governments. We can impress upon them. And the government takes us seriously because they understand that we are a neutral party. They are ready to listen to us. So I think advocacy in the field of environment is going to be extremely, extremely important. And we'll have to lead by example. So our conferences, etc., let us all try to make them as green as possible. These will be some of the steps that we will be able to take. Once we start taking those steps, we will have greater determination to go and do advocacy for both environment as well as for disease prevention. I once again thank my dear friend Sanku Yun. Thank you, Sanku. Despite all challenges, you've put up an excellent conference which has served its purpose. Yes, the fanfare may not have been there, but that's all right. The essence, the meat of the entire thing has been there. People have understood the two very, very important subjects. And I thank you and all the organizing people who've been at it. Thank you also for the warmth that you have shown to Rashi and me. It's been absolutely a pleasure coming here. Thank you very much. Kamsamida.
네, 감사드립니다. 이제 2021
Yes, thank you very much. It is time to wrap up the 2021 RI President Conference Gyeongju. Once again, a big thank you to all of you for attending the conference and speaking at the conference. This will be re-edited, and the video, the highlight video and the video of the entire event will be uploaded on our YouTube channel so that more people can watch and participate in the event. I hope that you will tell others about the event and how it will be uploaded. And I hope that you will stay tuned to watch the promotional videos that we have prepared as well. And it will also be screened here at the venue. So I hope that you will all stay. And the Vice Chair of the RI Foundation, Trustee Yoon Sang-gu, will be giving a closing speech and declare the closing of the event. I hope that you have all enjoyed yourselves and it was a productive time. Thank you very much to President Shaker and the participants from Korea, Japan, and all around the world. Thank you for attending, and also thank you to all the speakers who have given presentations and the two MCs and all the staff on the organizing team. Thank you very, very much for all your efforts. With this, I declare the closing of the first President Conference in 2021 held here in Gyeongju.
위기가 닥치면 우리는 해결책을 찾습니다. 그리고 위기의 순간에 반응합니다. 2020년 코로나19에도 그랬습니다. 세계가 백신 개발의 경쟁을 벌일 때 수아마비 퇴치 인프라가 지역사회를 팬데믹으로부터 보호하는 데 큰 역할을 하고 있었습니다. 눈에 보이지 않을지 몰라도 질병과의 싸움에서 중요한 역할을 하는 도구입니다. 수아마비 바이러스를 추적하고 매년 수천 건의 샘플 테스트를 실시합니다. 또한 허브와 긴급 운영 상태를 통해 중요한 자원에 집중합니다. 백신을 안전하게 전달할 수 있도록 정교한 물류 네트워크를 유지하고 보건 요원들을 훈련시켜 아동들에 대한 예방접종의 중요성을 지역사회에 알립니다. 이제 로타리와 그 파트너들은 이 같은 수아마비 퇴치 인프라를 코로나19 대응을 지원하는 데 사용하고 있습니다.
안 해도 되겠습니까? 예, 안 해도 됩니다.
셋. 네, 잠시 안내 말씀드리겠습니다. 오찬 장소는 호텔 1층 커피숍 옆에 서라벌 식당입니다. 다시 한번 공지합니다. 오찬 장소는 호텔 1층 서라벌 식당입니다.
네, 감사합니다.
세계 곳곳에서 이상한 징후들이 나타나고 있습니다. 지카 바이러스, 탄저병, 코로나19 바이러스 등까지 그동안 지구상에 없던 신종 바이러스 등장으로 인간의 삶을 황폐화시키고 있습니다. 그뿐만 아닙니다. 기후변화로 인한 기이한 현상들이 일어나는가 하면 동물들이 떼죽음에 이르기까지 하고 있습니다. 얼마 전 적도 위의 아프리카 카메룬에 때 아닌 우박과 눈이 내려 카메룬 당국은 기상이변의 매우 이례적인 현상이라고 한 소식통이 발표했습니다. 또 여름날 갑작스런 폭설과 토네이도와 홍수, 그리고 수면 상승으로 밀어닥친 해일, 잦은 지진과 지형의 붕괴와 농토의 황무지와 현상 등까지. 우리는 이 아름다운 지구별에서 언제까지 존재할 수 있을까요? 우리가 살고 있는 아름다운 지구에게 그동안 사용했던 임대료를 지불해야 할 때가 도래된 것은 아닐까요? 봉사는 내가 이 지구에 차지하는 공간에 대한 임대료를 지불하는 좋은 임차인이다라고 국제로타리 세이커메타 회장은 환경보전의 경각심을 생각하며 봉사하자고 강조하고 나섰습니다. 이 강력한 메시지는 로타리안과 비로타리안들에게 시사한 바가 크고 모두를 공감케 했습니다. 국제로타리 존 1112 로타리안들은 작은 실천으로 환경 보전을 위해 곧바로 행동에 옮겼습니다. 우리가 그동안 잘 사용했던 지구에 대한 아주 작은 보답의 의미입니다. 가장 중요하면서 시급하고 위대한 여정이 시작된 환경 프로젝트는 온전한 지구를 회복시키기 위해서입니다. 우리 일상생활의 귀환은 언제 도래될까요? 전대미문의 코로나로 인한 이 팬데믹의 터널은 언제쯤 벗어나게 될까요? 무심코 버려지고 방치시켜 지구를 오염시켰던 지난 과오를 알고 계십니까? 가장 흔하게 버려지는 폐비닐과 폐플라스틱, 폐페트병을 분리수거하고 재활용하는 운동에 앞장서고 있는 현장입니다. 국제로타리 존 1112 로타리안들이 환경 보전을 위해 프로그램에 편성한 봉사활동을 펼치고 있습니다. 오염된 지구를 다시 복구해서 미래 세대에게 깨끗한 지구를 되돌려주기 위한 플로킹 프로젝트. 어쩌면 이 작은 움직임이 지역에서 환경을 깨끗이 지키는 운동을 견인하기 위한 노력을 기울이고 있는 것입니다. 이 프로그램의 실천을 통해 시민운동으로 일어나 범세계적 운동으로 확산되었으면 좋겠습니다. 이 작은 부싯돌 같은 불씨가 들불처럼 번져나가기를 바랍니다. 플로킹 운동을 부지갱이 삼아 활화산처럼 퍼져나가길 고대하며 진행된 봉사활동은 궂은 날씨를 무색해 할 정도입니다. 여기저기 흩어져 버려졌던 플라스틱 쓰레기들, 폐페트병이 한데 모아지고 있습니다. 지구 환경 오염의 심각성을 인지하고 이 해결 방안에 한 발 앞서 새로운 과제를 적극 전개하고 있는 것입니다. 국제로타리는 지구촌에서 가장 시급한 해결 과제를 6대 초점에서 최근 환경 부문을 추가했습니다. 지난 7월 1일 7대 초점 분야로 늘려 1회를 실천하고 있는 것입니다. 우선 일상생활에서부터 로타리안들이 앞장서고 있는 환경운동은 우리 이웃과도 함께 실천할 수 있어야 됩니다. 아파트 쓰레기 분리수거를 비롯해 도심 휴식 공간인 공원, 그리고 유원지에서 호수 주변과 해안가와 산책로에서 주기적으로 환경 봉사 활동을 펼치고 있습니다. 우리에게 다양한 먹거리를 제공하고 지구의 온도를 조절하는 중요한 역할을 하고 있는 바다. 바다는 비를 내리게 하고 우박이나 눈비를 만들어 지구 온도를 조절하는 기능을 하고 있습니다. 바다가 제 역할을 하지 못하면 결국 지구는 해수면 온도 상승으로 황폐화가 됩니다. 사막이 되거나 지표면 온도가 올라가 식물이나 인간이 더 이상 존재할 수 없는 환경으로 만들어버립니다. 바다는 우리가 지구에 생존할 수 있는 중요한 역할을 하고 제공하고 있는 것입니다. 하지만 문명의 이기 때문에 바다가 몸살을 앓고 빠르게 더럽혀지고 있다는 생태학자들의 주장에 귀 기울여야 합니다. 우리가 무심코 버린 쓰레기나 페트병이 우기나 장마 때 바다로 흘러들어가 바다를 오염시킨다는 사실도 그 일부 주장의 하나입니다. 가장 심각한 바다 오염의 원인이 폐어구와 폐페트병이나 폐비닐과 폐타이어 등 생활 쓰레기 등이 바다를 오염시키는 주범 요인으로 작용합니다. 화장품 용기나 반찬통에 이르기까지 폐플라스틱 용기 등 생활 쓰레기 종류와 양만도 어마어마합니다. 이미 전 세계적으로 해양 오염 실태를 분석한 결과 바닷속 생태계는 급속도로 오염되어 있다는 보고서는 줄을 잇고 있습니다. 해안가에 떠밀려온 고래 뱃속에서 폐플라스틱, 폐비닐과 섬유질계 등의 환경이 우리의 생활 깊숙이 역습하고 있는 것입니다. 미세 플라스틱은 세계 가장 깊은 바다에서도 검출되고 심지어 극지방 빙하에서도 나타나 충격을 주고 있어서 봉사 현장의 의미가 남다릅니다. 바다 생물과 육지 식물에서 여러 환경 등에서 검출되는 미세 플라스틱의 등장에 인류는 긴장해야 합니다. 또 우리가 코로나19 팬데믹과 싸우는 동안에도 쓰고 버려진 마스크는 116억 장 정도가 됩니다. 마스크에 걸려 날지 못하고 죽음을 맞는 새들이 있는가 하면 바닷속을 유영하는 마스크를 생각해보면 환경 문제는 심히 그 정도가 매우 우려스럽다고 봅니다. 이에 대한 심각성을 인지하고 국제 로타리 존 12 로타리안들이 지속적으로 펼쳐온 해양 환경 사업이 특별한 의미를 부여하고 있습니다. 섭씨 30도가 오르내리는 해안가에서 태풍 영향권으로 파도에 밀려온 폐어구 수거 환경 봉사에 로타리안들이 피지땀을 흘리고 있습니다. 방조제에서 수거된 대부분의 쓰레기는 우리가 무심코 버려졌던 것들이 우리에게 다시 되돌아온다는 사실입니다. 우리가 특별한 의미를 부여하지 않고도 대로 주고 말로 받는다는 속담처럼 큰 교훈이 되고 있습니다. 그뿐만이 아닙니다. 매일 식탁에 오르는 천일염이나 푸른 채소나 당근 등에서 미세 플라스틱이 검출됐다는 학계 보고에 충격을 주고 있습니다. 방치해둔 농가용 폐비닐을 수거하느라 분주하게 봉사활동을 펼치고 있는 로타리안들의 모습입니다. 로타리안들이 분주하게 모은 쓰레기의 종류와 양은 실로 엄청납니다. 이를 수거하고 깨끗이 세척해서 다시 우리 생활 속의 옷이나 편리한 생활 도구로 다시 돌아오게 하는 자원순환 운동을 로타리안들이 주도하고 있는 모습입니다. 쓰레기를 수거해 다시 재생하는 폐플라스틱, 폐비닐, 리사이클링의 귀환. 자원 재순환 운동에 로타리안들이 양팔을 걷어붙이고 발벗고 나서고 있는 현장입니다. 지역마다 특색 있는 환경 봉사활동 등을 통해 우리는 이미 그 수위가 위험에 도달했다는 것을 간파하고 경계하고 있습니다. 환경오염으로 인해 생태계 파괴로 이어지고 지구온난화 현상으로 연결된다는 사실을 잘 알고 있는 것입니다. 지구가 몸살을 앓고 있는 심각성을 과학자들은 오래전부터 위험 수위에 도달했다고 예고했습니다. 극지방의 빙하가 빠르게 녹아 해수면이 상승하고 있습니다. 지구 평균 온도가 상승해 기상이변과 질병으로 이어지고 있습니다. 우리가 전개하고 있는 환경 프로젝트가 이미 시작점에서 늦어졌는지도 모를 일입니다. 세계 권위 있는 사이언스지를 비롯 환경 전문 과학자들은 여러 차례 지구 위기설을 강조하고 지적했습니다. 질병연구기관과 석학 등은 심각한 지구 오염 단계를 넘어 위험에 도달했다는 경각심을 가져야 한다고 인지시키고 있습니다. 세계 환경 전문가 및 유수의 지구 연구기관들도 앞으로 닥쳐올 지구 미래 현상 등에 예고한 바가 있습니다. 최근 지구촌 곳곳에서 예기치 않게 벌어지는 이슈 등에 대해 지구는 이미 빨간불이 켜져 있다고 목소리를 높이고 있는 것입니다. 동서고금을 막론하고 가장 늦을 때가 가장 빠르다는 격언이 있습니다. 지구가 더 이상 시름시름 앓고 병들지 않게 국제 로타리가 무거운 돌을 먼저 들어올려 환경 보존의 길을 모색한 것입니다. 그동안 더럽혀지고 허파가 찢겨진 지구. 그리고 다시 깨끗한 지구를 만들기 위한 노력에 집중하고 있습니다. 지구 맨살에 상처난 환부를 잘 소독하고 더 이상 덧나지 않게 미연에 방지해야 하자는 취지입니다. 이 운동을 범세계적으로 펼쳐나가야 할 중요한 시기라고 봅니다. 다시 지구를 회복시키는 일, 환경 보존 운동. 지금 바로 우리가 나서야 할 때입니다. 그동안 지구에 상처내고 무상으로 사용한 임대료의 대가를 지불해야 할 우리의 뼈아픈 책무이기도 합니다. 더 빛나게, 더 깨끗하게, 더 활기차게 더 많은 영역을 넓혀 나갈 수 있도록 로타리안들이 먼저 나서주기를 바랍니다. 아름다운 지구별을 지키기 위한 노력을 로타리안들의 행동 강령을 통해 실천 과제로 삼고 적극 도전합시다.